ready when you are.
1 second. Okay, I'm going to do a countdown. 3, 2.
The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody, to the Tuesday Board of County Commissioners meeting for July 21st, 2020. Before we get started, I have a couple of housekeeping issues to go over. So we are in our virtual format, and the people that are watching, the public who are watching our meeting, when you register to watch the meeting, you're registered in our system as attendees. Attendees are webinar participants who are simply viewers of the meeting, an audience member. Your microphone and your webcam are automatically muted as attendees. However, there will be a time during the meeting that we will open it up for public comment. When that time comes, if you wish to participate in public comment, we'll ask you to raise your virtual hand. You should see an icon on your device that you're watching and simply press the icon once. When public comment begins, our meeting moderator will call names. When your name is called, you'll be unmuted and given 3 minutes for public comment. When your 3 minutes is up, you'll go back into muted status and the next name will be called, and you're welcome to watch the webinar as long as you choose. We'll try to give everyone who wishes a chance to participate in public comment, but please note, in the event that there are more people wishing to speak than the time allots, I may need to limit the number of speakers and or reduce the time allotted for each speaker. And then we may also need to do them randomly, and we haven't had to do that as of yet. And if you are a webinar participant, it looks like GoToMeeting, which is the platform we're on, is now able to accommodate more than 6 screens at a time. So if you wish to open your screen so that we can see you, that would be wonderful. So with that, we'll continue with our meeting. Are there any adjustments to the agenda from anybody? Okay, hearing and seeing none, we'll move on. Is there any emergency business?
No, there's not.
Okay, no emergency business, so we will move on to public comment now, and I'll toss it over to our moderator.
Thank you, Chair Buck. One moment, let me bring up the timer. We do have several people signed up for public comment. So at this time, if you would raise your virtual hand if you would like to speak during public comment, and I will call on your name. When I call your name, I will unmute you so that you have sound. When you see the timer begin counting down, you may start your public testimony. This will ensure you get your full 3 minutes. Our first person for public comment is, I apologize if I don't do justice to your name, Alec Primacian. Alec, I'm going to unmute your microphone and then I will begin the timer. 1 moment. Alec, you may begin your public comment. It looks like you are self-muted right now.
Can you hear me now?
Yes, we
Okay,
can.
good. Hello, commissioners. My name's Al Hernishin, and I am a board member of the Upper Willamette Soil and Water Conservation District. And it's time to present again my annual report to you. I came and talked to you guys last year and just sort of let you know what we were up to, and it's something I feel like I need to do every year. So I'm going to try to do this virtually in 3 minutes and then see what I can do after that. Just want to let you guys know that we are still conducting operations as best we can. We had a pretty good year. And even since March, you know, we've been able to get some things done with all the new restrictions, though it's kind of slowed us down a little bit. But we continue to work on conservation efforts here in the Upper Willamette region. And our biggest concern right now, I guess, is we still this area is changing, and there's a demand for our services. It's greater than what we can provide at this point. And so, just like any other public entity, we're limited by the funding we have. And so we write to compete for grants. We receive a certain amount of our funding from OWEB, which is lottery derived, but you all know that that's going to take a hit this year. And so we're, and the grant scene's competitive as well. So we're trying to look at different funding mechanisms and access different things and bring to the table some resources that, even though we partner with groups like MRT and Long Tom and eWeb, we have the ability to bring resources to bear that they don't. And so we're looking at some options to increase our funding. The other concern we have is that traditionally SWCDs have sort of been seen as more of a rural agricultural entity, and we still do a lot of our work outside city limits, but this area is expanding, and so what we're finding is there are services in the urban areas. So we're trying to look at maybe developing partnerships with ODF and maybe some of the neighborhood associations. But at this point, we're doing the best we can with what we've got, and we have 2 full-time staff and 1 part-time, and so that limits what we can do, but we can always do better. So seeing how my 3 minutes are almost up, I think what I'd like to do is, last year, I believe I delivered a paper copy of our annual report. And so what I'm going to try to do this year is send an electronic version, and hopefully that works. And if not, I'll get a paper version to you. But I'd like you to take a look at who we are and what we do. Our website, uwswcd.org, is up and running, and we'll do the best we can. And always looking forward. We're willing to meet with you guys and talk with you at any time. So thanks for your 3 minutes. We appreciate that.
Thank you for your public comment. Our next presenter will be Arwen Moss Despain. I will restart the timer, and I will unmute you, and it looks like you are self-muted as well. Once the timer begins, you may start your public comment.
Hello, can you hear me?
You may begin your public comment.
Hello. Thank you, commissioners, for the time today. I just wanted to speak in support of Soraya Johnson's inclement weather strategies proposal. I am the executive director of Carry It Forward, and we do a lot of the similar initiatives that are proposed in the proposal. And particularly over the course of COVID, we've been involved in a number of the shelter-in-place camps and low congregate shelter we've been involved with, as well as using motels for sheltering vulnerable individuals on the street. And I really appreciate what she's done with this report. I hope that the county and the cities take these proposals seriously and implement as many of these options as possible. My real only feedback is that I'd really like to see the numbers bump up so that we're actually providing more options, more beds than are in the proposal. But otherwise, I just want to express my strong support for it. And also just say a little bit about the successes that we've had with these models over COVID. We've managed to help some of the camps self-manage in a way that was really effective for people to stay safe and in place. And so I also want to emphasize how important it is as we move forward in our planning to be able to focus on extra vulnerable populations that we're not serving very effectively. Folks that fall through the cracks are the people that we see the most of. And so I'm speaking specifically of the extra vulnerable elderly folks, medically fragile, Black, Indigenous, and Latinx folks. We need our services to be more culturally informed and trauma informed, and just more attuned to the ways that our systems do not serve folks or alienate folks. So anyway, that's all I wanted to say. I appreciate all your time. Thank you very much.
Thank you for your public comment. Our next speaker will be Donald Mathis. Mr. Mathis, I will unmute your microphone and reset the timer. When the timer begins, you may begin your public comment. 1 moment. You may begin your public comment.
Good morning, Commissioners. My name is Don Mathis. I am a member of the Fall Creek Park Association. We perform maintenance in our little park out here in the Fall Creek Lowell area, and I'm listening in hopes of hearing that the proposed name change of that park from Fall Creek to the Osgood Park gets approved today. Thank you very much for considering this. That's all I got.
Thank you for your public comment. Our next speaker is Michael Gannon. Mr. Gannon, I will unmute your microphone and I will reset the timer and you may begin your public comment. One moment.
Good morning, Commissioners. I wanted to talk a little bit about the efforts to provide services to the level of our population that needs more help and more attention. In general, I wanted to comment about the lack of self-management skills or the opportunity to develop those skills in the places that have been set aside for unhoused people. There's an opportunity to experience helping develop democratic processes and nurture the ideals of the democracy within those tiny settlements. So it's essential that agencies and government involved look at how they can address the leadership within those small settlements. Yeah, typically see people getting assigned to a settlement without any discussion among the community as to who should become a new. I think one of the most important aspects of that decision making is that the community are most to understand the debilitating effects of drug use and identify people who committed to hard drugs and be able to keep them out. But if they have no choice in the matter, usually what happens is they look for ways to go to another location. And then the other qualities that are generated by the drug using create litter, dissension, and poor health. And the drug use is, I think most people admit that it's a different problem, but we're not seeing that there is a satisfactory response that matches the oppression that's created within its entire population by that kind of heavy drug use. And the other thing that is important is—
Thank you for your public comment. I will now move on to our next presenter. Our next presenter is Mike McFadden. Mr. McFadden, I will unmute you and I will restart the timer and you may begin your public comment.
Hello, good morning. Thumbs up if you can hear me. Thank you. So I'm calling in this morning to give some comments about some concerning news that's been reported about some detainees at the Lane County Jail. And I'll just start by sort of recounting to you a story that happened 7 years ago. The previous speaker and I, Michael Gannon, had been protesting at the the Wayne Morris Free Speech Plaza, and we were both arrested during that time. Two of the board members today, Pat Farr and Jay Bozovich, actually voted for that closure, the emergency closure. But at any rate, yeah, I was taken into custody for being in the plaza, trying to challenge that closure order, and was arrested by the Eugene Police Department. And at the time I was arrested, they took my wallet out from my back pocket and took my driver's license from out of my wallet. But then they took me to jail because they said that they couldn't identify me. Before I was taken to jail, I spent around 45 minutes in the back of the Eugene Police Transport van, which was in the sun and became incredibly hot inside. And I tried to get the attention of an officer and was told sorry, essentially, and that if I damaged anything inside of the metal tank inside the van, that I'd be charged with more crimes or whatever. Anyway, so I go to the jail, and at the jail, I had my head slammed up against the wall, and I was told that I'd be stripped and thrown into a holding cell with no clothing if I didn't answer their questions. And then I spent, a good almost, 18 hours inside that jail with my frantic wife trying to find out what had happened to me with no access to a phone. And after I was released from the jail, the Eugene Police Department spent the next week following both my wife and I around town, all because I attended a protest. And so when I hear these reports of people being followed by the Eugene Police and people being denied medical care in Lane County Jail, I tend to give them some weight because I have lived experience of this jail and these Eugene Police Department officers, doing things like that. And so I hope that when you all, as the Lane County Board of Commissioners, hear reports like this too, you take them really seriously and that they make you concerned. There have been instances in the past in the Lane County Jail where the county has been sued by detainees there for the lack of medical care they received that's resulted in tremendous harm to them and their lives and their families. So again, please take this seriously. The times are changing and there is a movement coalescing around social justice, and we will not be intimidated and we will not be stopped. Thank you.
Thank you for your public comment. Our next speaker is, let me restart, whoops, just a second. Our next speaker is Pamela Kraus. Pamela,
I just want to remind people to mute in their background if they can, so we can hear people a little bit better.
Pamela, I will unmute your microphone and I will reset the timer, and then you may begin your public comment. One moment. You may begin your public comment, and it looks like you are self-muted.
Can you hear me now?
We're coming into Albany.
Can you hear me now?
Salem.
Yes. Yes.
Yes.
Okay, thank you. I apologize. I'm on transit up to my mom, whose life has changed because she now has broken many things with the call. In any case, I'm on a bus. That's my reason in the background for me to continue. Can you hear on top of the bus noise?
Yes. Yes.
Okay, thank you. So first I want to thank you for taking testimony like you always do, and to tell you that Lane County has stepped up way stronger than the city of Eugene for many issues that are being addressed today, and I highly appreciate that. There is so much still work to do that needs to be based in discourse and listening with the whole community. The time I spend listening to the pain, further traumatization, more desperation, and turning to unhealthy practices of drug use and seclusion and illness in the unhoused community is ramped up really high right now. We can change that. Discourse needs to happen and include the people in all areas of our community. We're one community. I want to thank Aaron and Michael for their very articulate comments on some of these issues today. You need to be aware of some things that go on in this community. For example, one person who had been placed at Dusk to Dawn for quite some time has had multiple issues with not being legally even supported, accommodated with needs for a physical disability. That person finally threw up arms last week after being banned from the indoor part of 99. That person has a spinal cord issue. Spinal cords, please do your research and ask St. Vincent's to do that as well. Spinal cord issues have extreme delicacy with heat control. The person's request was to be out of the heat, and they were denied that and then banned from the facility because they insisted on it. That's one example. So I also want to support the proposals by Sari Johnson very, very heartily. And I hope you pay attention to the delicacy that is erupting into disarray in our community because there is no common discourse and group value of each other. So thank you very much for stepping up. I'm done.
Thank you for your public comment. Our next speaker is Chris McAllister. Mr. McAllister, I will unmute your mic and then I will reset the timer and you may begin your public comment. One moment.
Good morning. My name is Chris McAllister. I live in Springfield. Thank you for your time and your service. I wanted to first call attention to the inclement weather report that Ms. Sarai Johnson is sharing with y'all today. I really appreciate the attention to detail and the way it wraps up what we as a community have been working on, but puts it in a format that I think more people can understand and actually move forward on. Those of us who've been working on these issues for the last 4 years and even more can see like a lot of the projects that we've been trying to interface represented here. So I feel like the comprehension in here is great. I also wanted to echo what Arwen said about making sure that we secure supports for people in the gaps. As we provide shelter in these unstable and confusing times, we want to make sure that we don't forget people once we get them placed at one spot, that we keep coming back to where we were and seeing if we've brought everybody with us. We have people waiting to get into inpatient. We have people waiting to get surgeries. And once they get their surgeries, we need places for them to mend. Once they get into recovery, we need places to make sure that they're supported. And I have the utmost respect for the teams that are building out these answers with data. Let's utilize the point in time count data. Let's utilize the service provider data. And let's make sure that we move forward as an entire community. Thank you for your leadership and thank you for your support.
Thank you for your public comment. Chair Buck, at this time I do not see any other hands raised. I will give everyone, I do see one more person on, but I do not see your hand raised. So if you would like to give public comment, please raise your virtual hand at this point. And I do not see anyone else wanting to speak. So I will turn the meeting back over to you, Chair Buck.
Okay, thank you everybody for your public comments. We'll move on to Commissioner's response and remonstrance. Would anybody like to speak? Commissioner Farr, and then Commissioner Sorensen.
Excuse me. Thank you, Chair Buck. A couple of direct responses that will kind of wrap into something I'll talk about later. The first to Mr. Hernishan, Upper Willamette Soil and Water District. You've mentioned some of the partners you're working with regarding grants and funding efforts. I'd like to mention Metropolitan Wastewater Management Commission. You did not list them as one of your potential partners. They do reach out extensively with partnerships to environmental groups. And if you go to their website, which is NWMC Partners, you'll get information on that, or you can contact me directly at my office. To Arwen Master Spain, it's good to hear your voice again, Arwen. I just wanted to point out that I drove by this morning, as I do most mornings, your facility on Highway 99, which used to be Camp Lane. It was the not Camp Lane, excuse me, but Camp 99. You're doing a wonderful job. A couple of years ago in my office, you and I talked about having people in residence actually doing some of the work that used to be done in your garage. That is the work of laundering recovered materials from campsites and returning it to the original owner or recycling it to new ownership. You're doing that at Highway 99, and you also have done one of your goals. You're beginning to actually house some of the people who are performing the work in your services right there on site. Well done, Arwen. And I look forward to continuing your work, continuing to progress. Mr. Gannon, it's good to hear your voice again. You have been regular in attendance at the Poverty and Homelessness Board's Shelter and Supportive Housing Committee meetings. I'd like to mention that's been changed to the Shelter Stakeholder Committee. We will be meeting on Thursday of this week at 2 o'clock. Join virtually. Since we started virtual meetings, I've not seen you in present. You can join virtually. That information is online, or you can contact me at my office. The Shelter Stakeholder Committee is a subcommittee of the Poverty and Homelessness Board that is an intergovernmental committee. It is populated, the members include the Mayor of Eugene, the Mayor of Springfield, the Director of Homes for Good, the Director of the Mission, Sean Murphy, who is a local nonprofit director in providing housing, Chris McAllister, whose voice you just heard a few moments ago. Also, Dan Bryant is on that committee, and we continue to do our work assisting Sarai Johnson currently, who is the chief staff for that committee. And we'll be hearing the report again on Thursday. So be there Thursday at 2 o'clock. That is the Shelter Stakeholder Committee of the Poverty and Homelessness Board. And finally, regarding the situation at the jail surrounding COVID-19, the sheriff has provided a pretty extensive report on how COVID-19 is being handled in the jail, how emergency efforts are being handled. I'll not go into details on that right now. I may do that later on in the meeting if necessary, but that report is available online. It's also available publicly in a number of different places. You can contact my office or send a general message to the Board of County Commissioners to get more information on that. Thank you.
Commissioner Sorensen.
Thank you very much. And first of all, I would like to thank all of the people who presented public comment today, and I appreciate the information that you shared with us. I'm going to devote my time during this portion of the meeting to ask a number of questions regarding Lane County's response to the COVID-19 pandemic. The first is that when Lane County asked the governor and told the governor that we were ready to move from phase 1 to phase 2, my understanding was that we would revert back to phase 1 if there was an increase in cases, infections, and otherwise. And I don't think that's been done. And I hope that later in this meeting, staff can address the concern that we were told that we would go back to phase 1 if cases went up. And I'd like to just know why. My constituents are emailing me and asking why we have not requested to go back to phase 1, given that we've had an increase in cases. The second is I don't know enough about this to ask this question in a better way, but my understanding is that in an emergency, there's different phases, and we had an emergency declared, and yet there was a point so far where a recovery was declared, and so we downgraded our emergency to a recovery from an emergency. And my understanding is that since that downgrade, we have now had a resurgence in cases, and I'd like to know if the Emergency Operations Center is under this emergency or if it's in the context of a recovery from an emergency. And last but not least, 2 other points. Lincoln County, just to the north of us, has issued a public health directive, directive number 6-24- order 6-16-20. And my understanding is that order directs people to wear masks in Lincoln County. It does not have any enforceable provisions, but it is something that Lincoln County has done. I'm wondering why Lane County has not issued a similar directive. Finally, I had a conversation with Mr. Mokrahajski last week about the efforts that Lane County is making to further educate the population on the importance of social distancing and masks. And perhaps sometime today, staff can give us an update on those educational efforts. And in particular, how much money are we spending on educational efforts compared with our previous expenditure for things like smoking or sexually transmitted diseases. So I'm hoping that we can delve into those issues during this meeting. Thank you.
Thank you, Commissioner. And if you might notice, we changed the order of going into our COVID-19 response and recovery discussion right after public comment and before consent calendar, where we just moved this to see if this works a little bit better so the public can be involved in that conversation and not wait too long. Any other commissioner response or remonstrance? Commissioner Bernie.
Thank you. Let me echo the thanks for everyone that spoke this morning. I can't, two things. One, it's hard. I don't know if you all have noticed, but if you watch the news and even watching some of the ads, it's hard not to feel pain and almost emptiness and a sadness. There's so much pain and suffering. And I think that becomes the fundamental issue. I have no insights other than what I tried to contribute in an editorial last week about let's look forward to how we want this to look to mitigate this type of pain, suffering, marginalization that I think many of the speakers have discussed from their respective perspectives. As a result of some of their comments, I'm looking forward to Sarai's presentation with even more enthusiasm. I think it's very cool to have people that are typically criticizing, but to kind of so many voices to say, we really like what you're going to hear this afternoon. So I'm even more eagerly looking forward to that discussion. And I wanted, one of those feelings I am, Oregon's Nicholas Kristof, who is a contributor, national writer, wrote an article that I believe was published yesterday. And the title of it is, "We Interrupt This Gloom to Offer ... hope." And he made a case that likens many of the manifestations of the issues that we're dealing with now to the Great Depression, and how many of the circumstances of the Great Depression created the opportunity to take leaps forward and elect Roosevelt as president and initiate the New Deal. And he makes a very persuasive case that if we are diligent, that might be the most hopeful way we can look at this as we try to get through it, both individually and collectively. Thank you.
Any other commissioner response? Commissioner Farr.
I apologize for asking to be back in the queue, but I failed to mention to Chris McAllister, if you're still listening, I'd like to congratulate you on being elected last week by the Poverty and Homelessness Board, by the Executive Committee, to be the new chair of the Poverty and Homelessness Board. Congratulations. That needs to be ratified yet by the full board, but I would expect that to happen in the next, over the course of the next month. Congratulations, Chris McAllister.
Any other final comments? I just want to respond to Dawn from the Fall Creek Park Association. We do have that item on our consent calendar, which will be coming up in the meeting. We are, I am very supportive of the name change. I know Ms. Osgood and her husband were integral to taking care of the Fall Creek Park, and there's 2 Fall Creek Parks. So it's really wonderful to see this name change of one of them to her name and all the good that she had done in the community. And thank you for bringing it forward to us. And we will consider that in our consent calendar in just a little while. I too want to thank everybody who spoke. I look forward to the conversation later as well regarding the unhoused and what we can do and inclement weather issues that might be coming forward, either wildfires, snow, or just cold weather. So we'll talk about that soon in our meeting. Thank you all for taking the time, and I'm glad we got a few more people who are able to catch on to our public comments and get online with us. So that's great. We'll move on then to County Administration and our COVID-19 response. We have with us Karen Gaffney, our Emergency Division Manager and Director of HNHS, and we'll have Greg Rickoff, our Director of Operations, chat a little bit too.
Good morning, Chair Buck and Commissioners. Greg, would you like me to go ahead and start?
Jump on in.
Okay, excellent. I have a bit of a lengthy report for you this morning. I will answer the questions Commissioner Sorensen raised during remonstrance, as well as walk through the specific items that the board has asked us to regularly report on, as well as touch on a brief update on schools, because I know that's really timely and critical for our community, and then our outreach efforts. So I want to start by noticing that Health and Human Services is now in our 6th month of responding to COVID. We began our Department Operations Center in February, and we're now in July. And I would expect that we are going to be at this for the foreseeable future. So we've often talked about how this is a marathon and not a sprint, and it's actually a number of marathons all strung together. Commissioner Sorensen asked about the status of our Emergency Operations Center. And just to be clear, we have not declared recovery around COVID at all. What is true is that in an emergency response, there are a number of, and I'm going to use the technical language, emergency support functions that can be activated depending on the type of emergency. So one of those, for instance, is health, our public health function, and that is absolutely still in response mode. There are some other elements of our emergency response where we have shifted into recovery, and some of that, for instance, is around our housing elements, and so the rental assistance, for instance, is a piece around fostering our recovery. So a little more than a month ago, the county decided that we needed to maintain an emergency response effort around the disease function, and so public health is doing that in our Department Operations Center, and we have been activated, as I said, since February and continue to be so. And then the county has also activated a separate emergency response function that Patience, as the county emergency manager, is leading. So those things are both continuing. We absolutely have not declared that we're in recovery mode related to COVID. So I want to talk a little bit about cases as the first element that the board has been tracking from the beginning. And the numbers that I have right now are our close of day yesterday numbers. Probably while we're having this discussion, I'll get an email with our new numbers for this morning. But we closed the day yesterday with a total of 400 cases since the beginning in March of our first case. And we had one person in the hospital yesterday. Of course, that number of cases is always going to go up. It's going to be additive. So we also track the current number of people who we determine are infectious as our sense of active cases, and to give us a sense of how significant infection is in the community in any given time. At the end of day yesterday, we had 60 people who we considered were infectious. A couple things about those cases I think are important to note for the community. One is that most of our cases continue to be traced to a known source, which is a key element that the health authority is tracking, and we are of course tracking sporadic cases versus known source. And in our community, I'm going to just shamelessly take this moment to do a plea with our community. We continue to see the bulk of our cases being connected to travel, whether that's people coming into the community to visit family and friends, or Lane County residents traveling elsewhere on a summer vacation and coming back. That activity is creating vulnerability for us. And so while I know people really would like to be able to see family and friends, and Lane County is a great place to visit, I would ask and plead with the community to really limit travel to essential travel at this point. And then the other place where we're seeing cases is with people who are close contacts. So those are the small gatherings that I know the governor has talked with Oregonians about needing to limit those small gatherings. That's where we're seeing transmission. And from my public health perspective, it's important to keep looking at that data about where are we getting cases, and then addressing our strategies specifically to limit the transmission there. This is really the opportunity for the public to do what's needed. And that's, of course, the same tools we've talked about from the beginning. We need to do good hygiene, so please wash your hands, keep physical distance from people. We have growing evidence now about the importance of masking up, and really asking the community to engage with us in that strategy. The final piece around cases is we've talked a lot about contact tracing in the community, and I did want to let the board know that and appreciate Commissioner Chair Buck's advocacy in this. We do now have a commitment from the Oregon Health Authority about rolling out the data software support for contact tracing that has been rolled out in a staggered way throughout the state, and Lane County has been near the bottom of that list because our case count has been so low compared to other counties. And we do now have a date the last week of the month. By the 30th of July, we should go live with that system. It's called Arius. And this week we sent in 126 contact tracer user forms to be able to load into that system, and we anticipate going live and it really helping with our ability to do that work. So that's cases. The second piece the board asked to be updated on is hospital and ICU capacity. We, as I said, at the end of day yesterday, had one person in the hospital. We did last week reach a point where we had 6 people in the hospital, which is of course concerning, and one of the elements that we're tracking closely as an indicator of serious disease. Our hospitals remain ready their expansion and surge plans should we need them. Right now, our ICU capacity is not impacted by COVID, but of course, it's one of those things that could turn quickly, and we're monitoring. The third element to update you on is testing. We know that that's been an important part of our toolkit from the beginning to be able to adequately test in our community. To date, we've completed more than 32,000 cases of people in, or tests for people in Lane County, and we regularly now are exceeding 600 tests per day average for the week, which includes weekends when some of those numbers are a little lower. Many days we're exceeding 800 or 900 tests a day, and again, that data is on our website anytime people would like to look at what our testing numbers look like. We are seeing longer turnaround times with national labs, and I know the media has been covering that as well. I just want to again extend our kudos and appreciation to McKenzie-Willamette Hospital, which is the local lab in our community who is running PCR testing. They've partnered with us from the beginning, and they continue to have much faster turnaround times and are offering drive-through testing for people who have a doctor's order for testing. So that's an important resource in our community, and Lane County continues to also be on a wait list for additional testing supplies. We have ordered 6 of the Abbott ID9 tests, and those are on back order. And again, with testing supplies, much of that is sent around the country based on hotspots and need. And as you know, there are some significant hotspots in the country, and resources are often diverted where the need is seen as higher. And then finally, I would say Lane County Public Health continues to do our surveillance reservoir testing. And I know the media has done an excellent job of helping to advertise those for us in the community. We held an event at the Lane County Event Center last week, as well as several targeted events in rural communities and and for communities of color. And we will continue to do that work to make sure, particularly those people who have limited access to healthcare and testing, are getting tested so we can track the spread of disease. The fourth area you asked for an update on is personal protective equipment, PPE, for frontline workers. We know that's one of the reasons it has been so important to flatten the curve, is to make sure that both our hospital capacity and our PPE supply holds out for being able to respond to medical emergencies. Happy to say that our frontline worker current stockpile is sufficient in the community. We continue to monitor that with our first responder partners, and are really leaning into the fall, knowing that it's likely we will have significantly more demand as we get closer to fall. So we as well as our healthcare partners are developing our stockpiles. I was notified yesterday that the state stockpile was shipping us additional N95 masks and gowns. We're continuing to bring swabs in and really make sure we're doing our part to make sure there's a stockpile here in our community. The fifth area you asked for updates on is around supports for businesses. And again, this is one of those areas that the majority of our work has shifted into the recovery structure, but I do want to give you a little bit of an update since I know that's an area of concern for the board. Austin Ramirez continues to lead that work on recovery with our businesses, as well, quite frankly, as helping support our efforts around response and being a really fantastic liaison to the business community when we have people who are testing positive in their workplaces. Austin's done just a tremendous job for us. The business grant program has been moving forward. We did have a total of 412 businesses that pre-registered for that program, with 253 being eligible after the review. And for the most part, people who were deemed ineligible was because they had already received federal assistance through other programs. We've applied for an additional $400,000 for this program, which would be used to fund eligible businesses who have pre-registered if we get those funds. We also are partnering with our business community, particularly the small business community, to help provide free KN95 masks for businesses. Over the past week and into this week, we're partnered with city and community partners to help with that distribution, and have distributed close to 50,000 masks to small businesses throughout the county. And again, those are targeted for businesses with 50 or fewer employees. And then finally, this week, we are launching our Lane County Business Office Hours. It's an opportunity to provide more outreach and communication between our COVID response and the business community. So we're hosting a bi-weekly virtual office hours every other Thursday, where our business partners are able to call in. We'll have a brief update for business partners, and then an opportunity for questions and answers as they continue to move through their recovery phase to COVID. So that's our business update. As I said, I want to give you, and I'm sorry, I know I'm going quickly, but I want to make sure we reserve enough time for questions and discussion. I want to touch briefly on schools. We are nearing the end of July, and the reopening of schools and what that will look like is a huge issue for all of us in the community, not only those who are parents of children or who happen to work in schools, but for all of us who really care about making sure our children get the best education possible and that we keep the community as safe as we can. I believe I reported last time I was here that we have been doing calls twice a week with administrative staff from schools, both public and private, across Lane County as they work to prepare their plans for reentry. Many of the districts are getting closer to having final drafts of those plans, and I know have been engaging in a variety of community meetings and other opportunities for their school community to respond to those drafts. Those are all due to us by mid-August, and we'll be able to do a review there. I will tell you, and I think this isn't going to be a surprise to anyone on the board, that the vast majority of schools are looking at some sort of blended hybrid system and are not planning on starting the school year as scheduled with children in classrooms. And there are a variety of approaches depending on the size of the school and the facilities they're working with, transportation needs and other things. Those are all tailored to the needs of the specific community. But I think everyone should plan that it will not be school as usual this fall. In addition to K-12, we're also reviewing plans from our higher education partners as well. And I'm happy to answer questions about that. Dr. Pat and I will be holding a meeting next week for elected school board members to also have an opportunity as they're preparing to sign off on their district plans, and then looking towards the fall to give those elected officials an opportunity to get their questions answered as well. Okay, let's talk a little bit about outreach. Commissioner Sorensen asked that question, and this is one of those areas where I feel like we've had this as a key part of our strategy since the beginning of our response in February. I want to take a moment to deeply appreciate Jason Davis, our public information officer, who is essentially full-time on COVID 7 days a week now, making sure that we're meeting the needs of media and the community and really getting those key messages out to the community. So a couple things in particular I would highlight around outreach, and I think there's a couple categories of things. So there's general public outreach, and Jason really has been leading much of this. In fact, later this morning, he'll be doing his twice a week presser that is also broadcast on Facebook and on Metro TV for anyone in the community to be able to observe. We do those regular media briefings every Tuesday and every Thursday morning. And truly, anytime I turn on the local news or open the Register Guard or the Weekly, there's coverage about COVID every single time. So Jason's really been doing a tremendous job of getting our story out. We also have focused a lot of energy and attention in social media. So I know each of the commissioners have seen those posts on Facebook and on Twitter and Instagram to be able to use that mechanism to also share critical messages about how to protect yourself, how to protect the community, the importance of masking, and also just giving the community insight and transparency into what the current status is in Lane County. I mentioned we use Facebook Live for briefings and Metro TV, and we've done some great work partnering with our Spanish language community as well. We have worked with Central Latino to provide briefings in Spanish that are also broadcast live on Facebook, and have purchased PSAs in Spanish on Spanish language radio for the last several months to make sure that we are getting the message to everyone in Lane County through a variety of targeted methods. In addition to that general public piece, we've been doing targeted outreach to high-risk communities. I want to, and I won't go through all of the details, but I do want to give you just a sample of, I think, some great work that we've been doing in Latinx outreach in South Lane County and the community there. As you know, we have a significant community in South Lane County, not only that doesn't have English as their first language, but many of whom don't speak Spanish either. There are a number of other languages in that community, and from probably March, we've been working to make sure that we are reaching our Hmong community and other immigrant communities there about the importance of wearing masks and gloves. So we recruited 5 high school students, young interpreters who are bilingual and in some cases trilingual, and trained them in early and mid-May to do door-to-door outreach in those communities. So those youth wearing masks and gloves go out into the neighborhoods door to door, have conversations with community members about social distancing, hand washing, disinfecting surfaces, generally how to protect themselves and their family members. We've distributed educational materials, reusable cloth masks, and hand sanitizer weekly since mid-May in that community. So over 200 masks, 100 educational flyers. And then every time we set up a testing event anywhere in the community, we're making sure that we bring educational and testing information to those sites. We're also working with sites in the community like food banks and other community touch points to make sure that we're reaching people who might not be the average Register Guard reader or television viewer, and connecting with them on these important messages. And then finally, the piece that we added last week is to do some purchased media. And again, looking at making sure we just are reiterating the message, particularly around masks right now, because that is something that each individual can do to help protect themselves and the community. So we have bought space on EMX buses. Turns out that some of the buses that used to have football advertised on are available for us. So we've done a buy on exterior for EMX buses, interior bus cards, and billboards in targeted areas to be able to, again, just reinforce that message, to ask people to do their piece in the community. Okay, 2 last quick things, and then I promise I'll turn it over. Commissioner Sorensen asked about the question of phase 1 and phase 2, and what's the decision point there. I would say when we talked about phases and our blueprint, we talked about case count as being one indicator that we watch, but it was never intended that anytime we have an increase in cases, we would move back in phases. That's we know cases will increase. We were approaching this as making sure we're maintaining a flattened curve, which it's not as flat as we would like by any stretch, but really keeping our numbers manageable so that our healthcare system is not overwhelmed. And we have done a good job of that. Our cases are higher than we would like. That's absolutely true. We are also, the trigger points that we talked about in our blueprint included looking at ICU beds and hospital usage for indicators of serious disease that could be a place where we might want to talk about additional restrictions. And then I would remind the public that when the governor introduced the phased system, she talked about specific gating criteria, and that is what we are watching along with the state. And there's a link to those gating criteria on our website, and they're posted on the Oregon Health Authority's website and refreshed each week, that look at percentage of ED visits for COVID-like illness, trends and testing that are positive, so our positivity rate. We look at the percentage increase in new cases in the last 7 days, the percent of cases that are not traced to a known source, trends in hospitalization over the last 14 days, and then the percent of cases we're able to follow up with within 24 hours. So those are the criteria that Lane County and the Oregon Health Authority are tracking for each community, and are the things that might raise red flags that would cause us to consider whether additional restrictions are necessary. I think it's important on this particular item, again, to loop back to the beginning of my presentation about where are we seeing cases. So the cases we're seeing are actually not, the primary transmission is not in restaurants and bars, the places that you might see impacted most if we were to return to a phase 1 level of restriction. And I think that's why the governor chose to do the specific actions that she did. Instead of moving everyone back to phase 1, she looked at a statewide mask requirement. So that's a piece that Lane County has not adopted its own mask requirement because we are covered by Oregon's statewide mask requirement, both indoor and outdoor. She has restricted the size of gatherings because that's where we know transmission is really happening. And again, encouraging people to think about those things we can each do that make ourselves safer. So it's safer to be outside than it is to be inside. You know, please remember to wear a mask anytime you're going to be out in public. Those are the things that we can do that will impact transmission. Certainly, if we were to see our gatekeeping criteria shift dramatically, we may be in a situation where we would need to talk about much more significant restrictions. I hope that the people in Lane County will see their way clear to doing each of our parts to make sure that doesn't happen. We need our schools to be able to open. They can only open safely if we are containing the spread of disease. So we need everyone to do their part in that. So perhaps I'll stop there, and I'm open to answer any questions you might have, and I'll take a look and see if I have some updated numbers.
Thank you. And it's nice to see your face on the screen today, although we can see other panelists on the screen for us. Does anybody have any questions? Commissioner Farr.
Thank you. I'm not going to ask any questions, just make a quick statement because I know the other commissioners will have specific questions. Karen, Commissioner Sorensen asked a couple of very pertinent questions this morning during Commissioner Response, and I listened closely as you systematically answered the questions that he asked. Thank you for that. I wrote down some very specific points that you made. You know, your regular contact with the Board of Commissioners almost daily makes this report really almost just a recap of what we've already heard, generally speaking, and other than things that have happened in the last perhaps 24 hours. And it allows us to ask you a few questions. You know, you systematically, specifically address the issues that we are concerned about, and I appreciate that daily. You also mentioned Austin Ramirez and Jason Davis, the work that they are doing in the community. And I had a note to single out Jason myself as to the fact that people are beginning to trust him. Have generally, not generally, but across the board, trust the presentations that he makes and the data that he gets out. So please let Jason know that he has become a great face for Lane County. You know, your balance report that you give on a daily basis and that you kept summed up today helps us to counter the many conflicting reports that we find on the internet or we find on the street corner or in phone calls and messages that we get. Your absolute data that you put forward gives us the ability to respond with data rather than with conjecture. That is really important, and that's what I look for in the work that you do. You allow me to personally view the data and the evidence of what's happening locally and compare it with what we see elsewhere. You know, for instance, when we hear a recovery was declared, and if people hear that, then and we've had a resurgence in cases, if people hear that single soundbite, that may cause them concern. But when they take that into consideration with your response that we have not declared a recovery, well then I hope people hear both sides of that, both the question and the answer. It's important that people hear the news of the progress that is being made, along with the flags that are being raised by so many different people regarding alarms that can cause depression, can cause people to withdraw, and can cause people to completely seize up in their ability to take care of themselves. accurate data is absolutely important, and not responding emotionally to the many things that you hear on the internet or wherever it may be. That's why I count on you, and that's why I count on the work that comes out of your office. You know, another statement that you gave today was really important that people hear. You praised Chair Buck. Praise is not the right word. You just acknowledged Chair Buck for her help in securing a commitment from OHA to roll out the contact tracing software. You said, this is a quote, "We've been at the bottom of the list because our caseload has been so low." I've not seen the specific worth of Chair Buck, but Chair Buck, thank you for getting that software out, because that's going to help keep our caseload low. And it's going to help keep us at the forefront of making sure we know where people contact and contract the disease as we move forward. So all the work that I'm seeing coming out of your office, and Chair Buck, all the extra work that you are putting in as the chair of this commission during the COVID crisis, thank you very much. I can sit back, and most of my work is reporting the work that you do. Thank you.
Thank you. I do my best to get those big issues up the chain of command as they come up in our meetings, and sometimes it works and sometimes it doesn't. Trying to speed up the paper trail into an electronic trail is a challenge. Anybody else like to speak? Commissioner Sorensen and then Commissioner Burney. I'm sorry.
Thanks very much. Appreciate the report, Ms. Gaffney, and you really did a good job in going down the list of my questions. I really appreciate it. The one question I did ask, though, that I didn't get a response on was about the efforts that they've undertaken in Lincoln County, and in particular their policy directive of their health director and their medical officer, as well as their board of commissioners, to highlight the importance of wearing masks, and also their sensitive, in my view, sensitive recognition of the impact that this disease is having on people of color, which is specifically called out in their local resolution. And I ask, why is it that Lane County has not done this, or you have not recommended it or taken the action? I just want to kind of drill down on that, because it seems to me that each community is different. And I think it's heartening and good news that we're hearing that our hospitalization rate went from 6 or 7 last week to 1. That's really good news. And I agree that putting out news, whether it's good or bad, is helpful to the public's understanding of the impact of this in our community. But just to give me your perspective on the matter of Lincoln County in particular, and their directive that they want people to be wearing masks, and that seems to be an important drumbeat from DC and experts that will be a way for us to beat this disease. And why aren't we highlighting that, rather than saying, well, you know, the governor, she does a lot of things up there in Salem, and this is one of them. Well, it seems to me that if local leaders will extend themselves and make these kinds of proclamations or directives, by the way, theirs is completely unenforceable, it has no enforceability, which I have another issue with that. But why aren't we at least doing what Lincoln County did?
Chair Buck, Commissioner Sorensen, a couple things. First of all, I would say that both Dr. Lutke as your health officer and I and all of public health have absolutely been telling the community we need them, want them to wear masks. So I think we have been very clear about that, and both through the media and through our purchased media, that's coming up. So I don't think there's confusion in the community about whether public health thinks that people should wear masks. I believe Lincoln County, and I would need to confirm this to be sure, but I believe that Lincoln County might have processed that action prior to the governor making her statewide mask requirement. So there really was a period of time, particularly I'm sure you recall Lincoln County had one of the most significant outbreaks in the state of Oregon. And prior to the governor issuing her mask requirement, I believe is when Lincoln County took that action. So there, certainly if the board wished to pass a resolution, you could absolutely do that. And we would be happy to prepare that for you in terms of prioritizing, bringing that to you as an action. Because the governor already took that step, it felt like it would be duplicative to bring a specific resolution here. And quite frankly, it's often easier for the community to comply if there's a single standard that goes throughout the state. And that's a piece of why it was helpful from a public health perspective to really have the governor take that step so that it was clear all Oregonians are expected to wear masks and under what conditions. But Commissioner Sorensen, anything you can do to help encourage your constituents to wear masks in your role as a county commissioner would be a fantastic help and support to our work. We are absolutely all in this together.
I'm going to change the order because I think Commissioner Bozovich had raised his hand and I didn't see it. And just raise your hand just a tad longer because I'm constantly scanning the screen.
Actually, I think Commissioner Burney was in the queue before me. I didn't raise my hand till after him. But if you're going to make me go first, Joe, let me.
I will go first. Oh, okay. I'm sorry.
Let me prepare to interact socially here. I just want to start my discussion with, I have always supported the idea of wearing masks in public, and it's about protecting other people, not yourself. And I just wanted to kind of reflect that a little bit today by demonstrating, that I do have a collection of masks and I do wear them when I go out in public. And I'm also very careful about, my hands and everything else. And I think that's one of the reasons why my wife and I were successful in our ability to travel to Kentucky and back. And she recently had to have foot surgery, so she had to get a COVID test prior to that and came back negative, after, more than 10 days from our trip. So there is the ability to travel safely if done carefully. So I just want to reinforce mask wearing just for starters. I also just want to mention that when we went into phase 2, one of my questions for the staff was, I also know we are now starting to increase our testing capacity considerably, which would mean our case count will go up with that testing capacity. And was there some balance in the data to make sure that that wasn't the only criteria about going backwards or forwards? And I think Karen reiterated that very well. It's not just about case count, it's about ability to trace to prior cases, ability to get in contact with those people, and whether or not we're starting to see that randomized cases out in the community that we can't connect to previous cases. And it does seem that most of the cases are travel related or they're related to small gatherings in homes, which is really where the mask comes in. And just thinking about, what's the safest way to interact with people. Don't have your party inside. Maybe you have it outside and you spread the chairs out, around your patio or whatever. Just be smart and don't take risks. I have a question that I don't expect an answer to, but I would like an answer maybe next week, Karen. As I look at data, we've had 262 deaths in Oregon. So if you convert that to an annual rate, it's about 630 deaths total annually. Looking at 2018 data, we had about 844 suicide deaths in Oregon and about 530 influenza pneumonia deaths in Oregon. We also had about 530 drug overdose deaths in Oregon. So we're sitting somewhere between suicide and those issues as far as mortality rate goes, which doesn't even get us into the top 10 mortality reasons in Oregon. But one of my questions is are we seeing, because we're starting to have enough data now where we're into our 6 month and our mortality data is about a month old, so we should have at least 4 or 5 months worth of data. Are we seeing changes in other causes of death? And I'm specifically thinking, with the decrease in traffic, we should be seeing a decrease in automobile deaths. Are we starting to see a increase possibly in suicide deaths because of the isolation issues? Are we starting to see an increase in drug overdose deaths? I've heard, kind of word of mouth that some of those are increasing, but I'm kind of curious to see where we are with that. I'm also kind of curious because they started combining the data on the CDC site with pneumonia, influenza, and COVID. But are we actually seeing a drop in influenza and pneumonia cases because people are using masks, et cetera? Everything you do for COVID works really well on influenza. So we've seen a drop in that particular category where this 629 annual cases we might see in Oregon gets balanced by a drop in influenza and traffic accidents. But what I'm concerned about is an increase in suicide and drug overdoses related to the economic impacts and isolation impacts of some of the ways we're trying to deal with this. So I know you don't have that data at the tip of your tongue and you'll have to go back and look it up, but I do know that we do collect that data. So I'm just curious about that because I kind of like to see what are the trends. Are we seeing trends? Because it's been long enough to start seeing them. I do have a final question though that you could answer now because I've asked it before maybe, and you sort of answered it last time that we weren't a priority because we were a lower case count, but I still have a real concern about elderly nursing and group home testing and our ability to test staff and residents and really try and be on top of an outbreak before it gets into one of those facilities, because we all know that the mortality with this disease is age related, and also, any sort of complicating health factors, which you would see in a nursing facility. So are we finally getting high enough recognition in the OHA that we're starting to do some of that testing here in our community, or are we initiating some of that ourselves? Because it seems like we did 300 tests for, quote, frontline workers that had almost 0 positives. That's 300 tests we could be doing with nursing home workers. So I want to hear a little bit about what we're doing to protect that most vulnerable segment of our community.
Thank you, Chair Buck and Commissioner Bozievich. Before I answer that question, and I will answer that question, I did want to let the board know we did get our updated numbers for this morning, and our current total number of cases is 406. We still have 1 person in the hospital, and our number of people who are infectious has dropped to 54 people in the community as of this morning. And I appreciate, Commissioner Bozievich, you bringing up the long-term care facilities. We have been very lucky in Lane County that we have not had a major outbreak in any of those facilities. We have had some isolated cases that we've been able to catch early and keep us from having the types of outbreaks that some other communities in Oregon and certainly across the country have had, where you're right, people are so medically fragile, it can really have horrible results. So in terms of testing, I don't believe that we have quite hit the OHA's priority list yet. However, most of our care facilities in Lane County are not waiting for that piece to come through. And anytime that we discover a case or a case is discovered in a long-term care facility, it is our practice to announce that to the media, and then the Department of Human Services also maintains a database that's publicly viewable anytime a staff person or a resident in a long-term care facility test positive. So if the community has any questions about that, that's a good resource to go to DHS's website, and you can check that. So we do, the reason we're finding those is because most of our care facilities are doing testing themselves now. And for the very reasons you talked about, not only is it important to be able to maintain the health and safety of their residents and staff, but quite frankly, it's the only way they're going to be able to stay open is if they're doing that affirmative work to make sure that that they are not having disease outbreaks in their facilities. So, so that work continues, and I expect as we head toward the fall and we get up on DHS and OHA's priority list, there will be support coming from the state to those organizations to continue that testing. And again, the state's plan is that everyone, 25% of the staff and residents will be tested every week, so that there's a rolling, by the end of the month, everyone will have been tested in every facility, and it will just continue to roll forward that way through the rest of the pandemic.
Thank you.
Commissioner Berney.
Unlike Commissioner Bozovich, I see no reason to wear a mask at this particular meeting. Let me several points. One, Karen, you mentioned, I'm going to get from the myopic to the more general. You mentioned that you're purchasing media. Why are we having to purchase media? Why are not public service announcements, or for example, ears, or some companies donating whatever is required as it relates to that? I'm curious. I mean, we're all contributing.
Yeah, thank you, Chair Buck and Commissioner Birdie. We have absolutely been using PSAs, and then with this particular media buy, there's an opportunity to leverage. So and I don't have the exact dollar amounts with me today. I can certainly get those if people are interested. But for every dollar we spend, we are getting free media bonus attached to that. So being able to use our dollars to invest in additional ad space.
Makes total sense. I would like to know how much that budget is when you have a chance. Okay. Number two, you mentioned that you're basically training and utilizing in South Lane County high school students for street outreach. Are you paying them?
Yes, we are. We gave a grant to the Family Resource Center, and I know many of you know Anna Maria Dudley, who is just an amazing force of nature in South Lane County. And this project was her brainchild, to be able to not only do positive development work for those high school students and give them practical skills and training, and use the great language skills that they have, and partner them up with healthcare providers in the community, but to also give them stipends and reimburse them for their efforts. So yes, we are paying them.
Thank you. I applaud you for that. I think we need more and more and more and more of that as we can. I won't get into I'm curious what you're paying, but we'll talk about that another time. You mentioned, because you mentioned so much. It was almost like I was trying to, okay, there's that subject and this piece of it. You mentioned that there will be next week, I think, a meeting with our health department and all elected school board members.
We have invited all school board members. Whether all of them will attend or not is still to be seen. But yes, it will be open to all elected school board members.
I asked for an invitation. I would like to observe that.
Absolutely.
Thank you. Forgive me. Like I said, there were so many areas. I think we need, for the listening public, if there is a listening public. I'm told there is. I personally would not have been able to follow all of Ms. Gaffney's reporting, especially on data and all these aspects, had she not provided us commissioners daily with facts and figures and status report, as I believe Commissioner Farr referred to. So for those that are interested and don't think we're getting the whole story, or don't think you are by watching this, Karen, what are the websites and where are the places they should go for all of this information and all of this data that you're basing this on?
Thank you, Commissioner Burney. The easiest way is for people to go to Lane County's website, which is lanecountyor.gov. And on all of our homepages, you will see a yellow banner that runs across the top and gives you a link to our COVID information. So if you click on that, it takes you to our COVID section, and then look for the local data tab. So if you look on the left, there's a place that says local data. If you click on that, you can find our not only our current test and case count numbers, which is what I just reported this morning in terms of how many people do we have in the hospital and how many are currently infectious. But there also are tabs across there that are marked on things like testing. So you can see how many tests we've done each day for the last several months, and how many of those are positive. You can see our data broken down, disaggregated by race and ethnicity, gender, and age. You can also see a zip code map. So if you're curious of where our cases are geographically across Lane County, you can see that. There's also a tab that's a statewide map, so you can see how Lane County compares to other states in Oregon. And that's just that one page. So anyone who is interested in more information, I really encourage them to spend some time on the county website. We use that as a central place to post information for and about schools, for businesses and employers, really using that as an anchor point. And then if you can't find the answer to your question, we also staff a call center 8 to 5 Monday through Friday, and you can find the phone number on that same website, and you can talk to a Lane County employee or volunteer in English or Spanish, ask your question. We have nurses who are available to talk with people who might have symptom questions, so that's really a great resource as well.
By the way, Karen did not pay me to ask her that. I just felt it was important for the public. Karen, I'm going to recommend, rather than go on, because I wrote down so many notes, the board may suggest this is a bad idea, but as I was listening to you, really, you gave 2 reports. One had to do with multiple aspects of the COVID-19 response, and one that you gave in the same breath and covered it with different ones had to do with business and economic recovery. And I honestly, I understand they're both connected to COVID, but I think it would be helpful to separate them. This is just one board member's opinion in future reporting. And so I wanted to make that point. And as it relates to business recovery, does Lane County keep a database, or does some entity, on the businesses in the county that have received, I don't know, is it the CARES Act, but the support for businesses, the businesses in the county that have received that to keep people employed, and how much money they have received, so we can have a sense both in the specific and in the aggregate of what we're receiving for dollars that are turning in our community? Do we have that?
Commissioner Burney, that's a great question. I'm looking at Greg to see if he knows the answer to that. I can talk to Austin, who would be in the best position to know if that data is being collected for businesses in Lane County, but I don't know the answer to that.
No problem. You know everything else. If we have that, could we see that at our next board meeting? And if we don't have that, could someone share with us how to get that?
Sure.
Thank you. Thank you, Chair.
Absolutely. So I'll just wrap up with a few comments of my own before we continue on with our agenda. So we do have some other items ahead of us. I was contacted yesterday to do an interview with KZI, which I did. It was on the news last night, but they were really interested in how we as a board were reacting to tourism after they heard, I think it was the city of Bend had voted to request that people not come and visit. And, you know, I wanted to just make it clear to everybody who's listening that I absolutely respect every city or county's individual decisions to keep their own community safe. They are different than Lane County. We are all unique, both with our residents and our geography and makeup of our industry. And so it's really important that we all individually make the right choices with the information that's pertinent to our own communities. And I rely heavily, as I think we all do, on public health staff to advise us as to what we should or shouldn't be doing in our community. So I just wanted to reiterate that to the public who may be listening today, that, you know, our counts are not now tourism related. They're small gatherings, generally family members coming to and from other states that are considered hotspots. And so that's the issue. So please, you know, think twice about whether you need to go to that small gathering. If you really do have to do that, then make sure you're doing it safely with masks and physical distancing so that we don't get the infection back into our community or invite infection into the community in which you're visiting. So with that, I think we'll move on to our consent calendar. Thank you, Ms. Gaffney, for your report. So is there a motion to approve the consent calendar?
I move approval of the consent calendar as presented.
Second.
Moved by Commissioner Sorensen, seconded by Commissioner Burney. Is there any discussion? Seeing and hearing none, we'll move to the vote. All those in favor, please say aye.
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 All those opposed, please say nay. Okay, motion passes unanimously. Thank you. So we're going to move on to item 7 on our agenda. Commissioner Posevich.
I just wanted to ask real quick. We skipped Greg Rickoff completely in that report, and I thought there was something he was going to be presenting too. So I saw him start to sort of raise his hand as you were getting ready to cut away from the COVID-19 update. So I don't know if you want to jump back and see if there's anything to say to us.
Sure, Greg, anything there?
Chair Buck, Commissioner Posevich, I will handle under items from the county administrator. So we're good. And how do you top Karen Gaffney and her presentation? She is a treasure trove of information.
All right, thank you for that.
You could do it. Come on, Greg.
So we've got item 7 under human resources, 7A, order 20-07-21-05 in the matter of approving the tentative agreement memorandum of understanding between Lane County and the American Federation of State, County, and Municipal Employees, Local 2831 General Unit. And with us is Inga Wood, Labor Relations Manager.
Chair Buck.
Yes,
Chair Buck.
Commissioner Farr.
Thank you. If I may take a second to declare a potential conflict of interest. My son is an AFSCME member, works for Lane County and Lane County Behavioral Health. I asked for a clarification regarding this. The items on the agenda ahead of us do include cost of living pay adjustments, which affect the entire unit. And the response that I received from the Oregon Government Board of Ethics, while somewhat vague, did give me some specific language that allows me to say that while I do perceive a potential conflict of interest, I do not perceive a statutory actual conflict of interest. I'm going to very briefly give the wording that helps bring me to that decision. Could the commissioner make a decision related to AFSCME and AFSCME contract that would or could financially benefit his son, e.g. increase in pay or benefits? This question lacks sufficient detail to provide you with a definitive answer. The commissioner would need to consider how the personal financial impact would affect the relative. It could be that the matter would affect all employees to the same degree. It is that last clause that that allows me to declare simply a potential conflict of interest and not an actual. Thank you, Chair Buck, for that indulgence.
Thank you. Ms. Wood.
Thank you, Chair Buck. Good morning, commissioners, and thank you for having us today. First, I would like to introduce who we have on the line today in case there are questions or others want to make comments. We have Larice Rivera, AFSCME President, Andrea Nagels, Assistant County Counsel, Christine Moody, Budget Manager, and Alana Holmes, Chief Human Resources Officer. If it works for the commissioners, we would like to present on the Memorandum of Understandings for both nurses and general unit, items A and B under number 7.
Yes.
Thank you. The current collective bargaining agreements between Lane County and the American Federation of State, County, and Municipal Employees, Local 2831, General Unit and Nurses Unit, expired on June 30th, 2020. The parties have met in successor contract negotiations and have reached a tentative agreement for a contract rollover, a Memorandum of Understanding, also known as an MOU. The MOUs for both units provide for a 1% wage adjustment effective the first full pay period following July 1st, 2020. Under these MOUs, all other language in the collective bargaining agreements will remain the same for the fiscal year and will expire on June 30th, 2021. The additional estimated costing for a one-year period for the general unit is $537,585. For the nurses unit, $120,145. For a total estimated cost for the one-year period for both contracts is $657,730, which should be in your packets as well for additional information. The bargaining teams will meet in late February or early March of 2021 to begin full contract negotiations. We would like to express sincere appreciation for the AFSCME employees and the AFSCME bargaining team for coming to an agreement for the rollover during these unprecedented times. Both AFSCME General and Nurses Bargaining Unit members have voted to ratify the tentative agreement, and the county's bargaining team recommends approval of the tentative agreement and authorization to county staff to implement the proposed MOUs. With that, we welcome any comments from AFSCME and or comments and questions from the commissioners.
I'll first ask if there are any comments from AFSCME members.
Can you hear me?
Yes, we can.
Chair Buck and commissioners, thank you for the opportunity to speak to you today. I have given serious thought about what I might share with you that best conveys the message of our membership would want you to hear. First, our membership understands, as it has many times before, it may be called upon to make sacrifices in the best interest of the communities we serve. While it appears there will be difficult financial times on the horizon as funding is likely to decrease in the future, we do not believe it is time to make sacrifices. I need to point out that management chose to add an additional 30 positions at this time. Second, we also know the decision by directors and management started much earlier than the COVID crisis in the country and our community. Our members know this started back in November and December when there were whisperings of only a 1% increase, even though all other bargaining units would receive a 2% increase. This disregard has not gone unnoticed by our rank and file membership, especially since 80% of them are still not paid equal to their market comparators. Receiving 1% now only widens the gaps between us and our comparators. Our members know who supports them and who does not. Our members know who value them in this organization and who does not. Again, our members who every day work face to face with our communities know who supports them and who does not. Our members will make the necessary sacrifices when needed, but stop telling them how much you respect and value them. Show them. Thank you.
Thank you. Any comments or questions from commissioners? Commissioner Bozievich.
Thank you. I just want to note that there was an article that came out yesterday in Politico that noted that one of the parts of this crisis around COVID has been an extreme decrease in wages and hours for many employees that did not already completely lose their jobs, and noted at least 4 million Americans have had their wages cut as a response for businesses trying to stay afloat during this crisis. I believe that, these rollovers were appropriate, and it looks like the bargaining units obviously voted in favor of them. So I fully support these contracts and look forward to continuing our relationship with the bargaining units.
Any other comments? Commissioner Berney.
First, hey, Larice, how you doing? I have the utmost respect for you and the bargaining units on both sides. I was as surprised and interested as many when Jim Steiner asked the question where people stood, and most commissioners didn't answer. I'm going to reiterate. I'm going to support this if your membership approved it. I personally was trying to make an economic argument for why providing a 2% consistent increase earlier would make more sense. The majority of my colleagues disagreed, and I have to respect that. But these are tough times, and I know for a fact that AFSCME is going to be in there, and as sacrifices are needed to be made, we'll be making them. I feel that this puts you guys a little behind the 8 ball in terms of when contracts are actually negotiated next year, and next year will be an opportunity. I hope we'll have the resources to make this right. Thank you.
Any other comments or questions? I'll just add that I want to acknowledge that our AFSCME members are our frontline workers that are looking out for our public health and safety during this pandemic, and they're doing a fantastic job. They deserve a COLA that matches their peers in other departments. I will be voting no on this particular item. My conscience just won't let me vote on it at this particular time. I asked for at least a commitment that if we get federal dollars, that we could come back to workers and try to find a comparable COLA that represents a fair value in comparison to other union members, and I could not get that. I realize that this may be a symbolic vote and it may pass without me, but that is where my conscience lies at this moment. Any other comments? Okay, seeing none, I'll ask, even though we've been talking about both the general unit and the nurses unit, we're now just picking up the motion for the general unit. Is there a motion to approve order 20-07-21-05 as presented?
I move approval.
Second.
Okay, moved by Commissioner Sorensen, second by Commissioner Bozievich. Any further discussion? Seeing none, I'll go. Commissioner Sorensen?
Yeah, I just wanted to say that in the course of labor negotiations between public employers and labor organizations that represent the workers. I have had a long standing support for the workers and the concerns of not only the workers, but their families. And whenever I'm presented with an agreement that have been approved by the bargaining organization, I generally approve of it. I don't disapprove of people voting no because it's not good enough and it doesn't do enough to help workers. I think that's a fine statement, but I think the key thing for me is these workers are deserving of an increase, and this agreement that has been negotiated gives them an increase. As I'm sure everyone listening to this probably recognizes, this is not likely to be something I'm going to vote on again because this agreement continues through next year, and my term of office will end approximately 6 months before this extension is approved. And I certainly want to encourage all sides to be mindful of both the demands in terms of the cost of living on our employees, the relationship between what the AFSCME employees are being paid relative to other groups within the county, and also the ability of the county to pay for the wages that we are negotiating. So that's the reason I made this motion, is that it's been agreed upon by both sides, and I believe the workers deserve this increase. Thank you.
Any further discussion? Commissioner Bozievich.
Thank you. And I will be supporting this motion also because the bargaining unit voted to approve the contract. But I just want to note that in the course of bargaining with now 8 different bargaining units, but at least 7 over my 10 years as a commissioner, there have been many years where bargaining units got different COLAs. There have been many years where bargaining units agreed to lesser health insurance benefits to save the county money ahead of other units. And in fact, this particular unit was one of the last units to agree to help us out with to control our health insurance costs. Yet we didn't hear, how unfair it was to the other units to go first with some of these things. They just happened to be the first units coming up for bargaining post-COVID. And I appreciate the fact that they were willing to approve a contract for 1 year. So hopefully next year we'll be able to bargain with them in a non-COVID environment and be able to be much more fair. And I just want to say that that's how you see differences between one bargaining unit and another, because we don't negotiate all 8 in the same time, same economic circumstance. We do them in different years for different units, and sometimes conditions change, and therefore there's mismatches in COLAs, there's mismatches in health insurance and other conditions. And in fact, some of the units represent such diverse employees that there's quite a lot of differential in the contracts. So purely looking at COLAs as the only way to judge whether we're being fair between units, I think is not a very accurate way to look at this. And I believe that we are being very fair in allowing this unit to get an increase in wages while at the same time postpone a full contract negotiation to hopefully better economic times.
Commissioner Burney?
Larice, may I?
Larice, yes.
I would like to respond to some of those comments. First of all, the savings in health benefits that some of the other bargaining units took on long before AFSCME agreed to it was because they did some deals that AFSCME was not willing to do. They were willing to separate their members from current members versus new members, decreasing their health benefits their TM accrual, all so that they could take an early retirement. AFSCME did not want to do this because we did not want to have a division within our rank and file members. Second, we want to talk about fairness, and you don't want to talk about COLAs. Fine. I urge you, especially you, Commissioner Bozovich, that you take the time and look through every contract, especially the economic portions, and you will see that AFSCME is not treated equally to our other bargaining units. Every other unit receives a contribution to their deferred comp. AFSCME, General Unit and Nurses Unit, do not receive that. Some receive even more than 2%. So when we want to talk about fairness, let's talk about the whole entire contract. And I, again, want to stress, we heard rumors back in November and December, not only would there would be only a 1%, but hey, we are looking at layoffs. We brought this to the county administrator. He didn't understand where that was coming from, or at least that's what was said to us. But all of a sudden, the county increases the number of positions by at least 30, and the expectation is AFSCME will take the sacrifice. I have no problem with us taking a sacrifice, but I would expect that all employees at Lane County make a shared sacrifice. That's all I have to say at that. Thank you.
Chair Buck, I need to step in for a second. Chair Buck, I need to step in for a second.
Yes.
The discussion is becoming dangerously close to my necessity to recuse as we begin to talk about things beyond the very specific motion that we're looking at. And I have to bear that close in mind, and I'm reading the ORS that has been cited by the Government Ethics Commission. I'm keeping a very close eye on that, Commissioner Buck.
Understood. Commissioner Burney.
Thank you. I think a point Ms. Rivera made after listening to the discussion thus far really rings true to me, which is, you know, we all can say whatever we need to say, but the fact is, what are we doing? I believe right now we're going to approve what's been ratified by AFSCME membership in this case. I don't know, we'll see. But I do want to say to my colleagues on this board and to AFSCME that I've dug into, you know, I'm not pro or against anything. You know, I'm obviously pro living wages for good work and fairness. I've dug into Lane County finances. I've dug into kind of fairness and equity issues. I've researched the requests that were originally made to this body. That discussion that we had was in executive session, so I can't really respond to that. But I do want to say that there are some unfairnesses here. There are unfairnesses that could be mitigated. This body, you know, chose to be what it perceives to be prudent financially. I appreciate that. I think there are relationships and there are other financial implications that will be visited upon us in a year as a result. I'm prepared for that. But truly, I think fairness is an issue. I really do. Now, having said that, I want to just share another thing. My wife and I, between us, in terms of what is happening out in the world out there, have 6 children, 3 of them have spouses. So we've got 9 kids, if you would, on that level. 6 of them lost their jobs, COVID related. 2 of them got rehired back. The net is not good. So I have a clear conscience about, given the process that came to a conclusion I didn't agree with, I have a clear conscience about approving this, moving forward, looking forward to next year, looking forward to creating fairness and seeing where our finances are and where they are not, and having a more in-depth discussion about all aspects, not just COLA. So thank you. I appreciate that, Chair.
Any other comments or questions? All right, before we take a vote, I'll just state that I hope that my peers can understand where I'm coming from. And for the general audience that's watching, knows how much I care and support our AFSCME members, who are majority of our employees at Lane County. I think that we need to take a good hard look at our upcoming budget to make sure that we do right by our AFSCME members in the next budget cycle and the next contract. If there are no other comments, we'll call the vote. All those in favor, please say aye.
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 All those opposed, say nay. Nay. Motion passes 4-1 with myself in the nay. We'll move on to item 7B, Order 20-07-21-06, in the matter of approving the tentative agreement memorandum of understanding between Lane County and the American Federation of State, County, and Municipal Employees, Local 2831 Nurses Unit. Commissioner Sorensen, and then we'll go to Ms. Wood. Commissioner, you're on mute.
I'd like to move approval of the order as presented.
Is there a second?
Second.
Okay. Moved by Commissioner Sorensen, second by Commissioner Burney. Any discussion? Commissioner Farr.
Chair Buck, I would defer to Ms. Wood if Ms. Wood has a presentation or an addition to make to the already proceeding discussion.
Thank you. Ms. Wood, do you have any additional comments for this particular item?
I do not. They were included in the first. Thank you, Commissioner.
Very good. So we have a first and a second. Any further discussion? Commissioner Farr.
Thank you, Chair Buck. Just this, we all lament in different ways the abysmally low wages that are paid in Lane County in comparison to other counties in Oregon and median wages compared to other states for that matter. We all lament the high cost of living in Lane County, the high cost of housing, and all of the things that make it very expensive to live here. At the same time, we're paying people across the board less than they're being paid in counties that have a lower cost of living. We talk about that often, and we do a great deal to try to recruit and encourage local private employers to increase wages, increase benefits, and increase jobs. We have limited success there. We have limited success and limited ability to increase people's wages in the private sector. We do have an opportunity and an ability to affect the people who worked for our organization, Lane County. And we owe it to them and to ourselves to make certain that we are doing our part always to make Lane County the place, Lane County government, Lane County as an agency, the place that people would like to work because of the wages that we pay being fair and being at the leading edge of the market, not trailing the market. It's important that we're make sure our benefits that we are able to control are among the best benefits that are available. And that's what we need to discuss always as we move forward. I'm voting yes on these two motions for many of the same reasons that have already been stated, but bearing in mind that we can't control what people in the private industry pay. We cannot control what the city of Eugene pays or what school districts pay. We do have impact on what we are able to offer as compensation to the people who work for Lane County. That is a very serious point that we need to take into account at all times. Thank you, Chair Buck.
Any other comments? I'll just mention that this is our nurses unit, and our nurses are exceptionally frontline workers who are working with some of our neediest populations, and I'm sure responding to our COVID pandemic needs. I feel the same way about this motion as I did in the previous one. And again, I know that is most likely symbolic, and it will most likely pass without me. Any other comments? Okay, I'll call for the vote. All those in favor, please say aye.
Aye.
All those opposed, say nay. Nay. Motion passes 4-1 with myself in the nay. We'll move on to item 7C, Order 20-07-21-07, in the matter of approving a cost of living adjustment for non-representative classifications. Ms. Wood?
Thank you, Chair Buck and Commissioners. The Board of Commissioners has in place collective bargaining agreements with Lane County Peace Officers Association, the Lane County Public Works Association Local 626, the Federation of Parole and Probation Officers, the Lane County Prosecuting Attorneys Association, the Administration Professionals Association, and the American Federation of State, County, and Municipal Employees Local 2831, physicians, and just now the nurses and the general unit. Lane County has approximately 267 non-represented employees, including administrative assistants, program specialists, analysts, paralegals, investigators, sergeants, lieutenants, captains, supervisors, managers, attorneys, and directors. For approximately 6 years, from 2009 through 2014, non-represented employees received no cost of living or other range adjustments to their wages. During that same period, represented employees received an average adjustment of 1.65% in cost of living adjustments per year. Since 2014, Lane County has made various adjustments to non-represented compensation similar to the changes we have made with represented groups in order to remain competitive in the market and avoid more costly adjustments in a single year. The recommendation before the board today is a wage adjustment for all non-represented positions, excluding elected officials, for a 1% cost of living adjustment effective the first full pay period following January 1st, 2021. This recommendation is focused on balancing the maintenance of a competitive position in the labor market for recruitment and retention purposes and providing cost of living adjustments within the county's budgetary constraints. The additional estimated costing for a 1-year period is $195,410. The county's human resources staff recommends approval of the cost of living adjustment in the amount of the 1% for employees in the non-represented classifications effective the first full pay period following January 1st, 2021, and authorization to county staff to implement the proposed changes. And with that, we would like to open it up to questions from the board and discussion.
Any questions from the board? Comments? Commissioner Berney.
So let me understand. I'm not critical. I'm just trying to understand. The first two items were negotiated at probably significant cost to both the county and AFSCME. AFSCME members pay a fee so that they're represented in these negotiations. And then is this item to take all of that work that's been done by a union to represent its membership, and wherever that's ended, saying, okay, the same thing applies to people that are not organized, are not paying union fees, et cetera. I'm just trying to understand, is that basically what item C would do?
Well, it's very different, Commissioner. It's not to take kind of the work that AFSCME has done for their unit. That's solely them bargaining for their unit. This is since 2014 when we started addressing the non-represented compensation. Non-rep were the first to go to the new health insurance plan, saving the county money there. And very often throughout the years, there's
and
yes,
hear the.
Can anybody hear me? The connection should be
yes,
restored
I
now.
hear you.
This is Diana. I apologize. GoToWebinar came up with the meeting saying they were having audio and technical difficulties. They said that they've now restored all functionality. Cameras should be coming back on and audio should be restored.
I see me.
Yeah, I see Pete and me.
Sorry,
I see Greg.
The GoToWebinar actively working on restoring. I keep getting pop-ups saying that the connection is always something, right?
Always something.
If it's not this, it's
I'm seeing cameras coming back, and I'm hearing audio again.
It's just missing Heather and Joe.
I'm wondering if they logged off, maybe. Let me see if they're still on. Looks like they may be logged off and are trying to reconnect. Hold on a minute. Tim Garner, can you take us to a blank screen for a minute, and I'll let you know when to resume. Thank you.
I was told you did that on purpose to us.
Well, I did.
Okay.
Very good. We're resuming. Thank you, everybody. We had some technical difficulty right there. We may need to rewind to where we were. The last I heard was Commissioner Burney's question to staff, and then everything went down at that point. So I don't know if staff, if you had started an answer, if you want to restart that, that would be wonderful.
Thank you, Chair Buck. I'd be happy to. So these are two separate items, Commissioner Burney. The non-represented staff, because they are non-represented and not part of a collective bargaining agreement, actually have no mechanism for asking for any type of raise or any type of market adjustments. So what I was saying is, over the years up until 2014, many times non-reps, because they have no bargaining obligation, were the ones that would be first to accept a 0% COLA, no adjustments to their wage analysis, even if they were falling behind market. And also they would be told to take essentially the health insurance changes to save the county money in all of those circumstances. since 2014, once we negotiate with all now 8 of the collective bargaining agreements, we try and take a look at non-represented salaries to make sure that we are trying to remain as competitive as possible, but obviously within the budgetary constraints. And also, as you can imagine, with the non-represented positions, when we negotiate with all 8 of the other collective bargaining agreements, if we don't keep pace with non-represented salaries, then we create a compression issue with our represented staff, where in fact, sometimes represented staff can be making more than those who supervise them. And so it's not that we are looking for represented groups to essentially negotiate for non-represented, it's just the way in which we have addressed those in the past.
Thank you for very comprehensively and kindly answering my question.
Any other questions or comments for staff? Okay, I believe we had a motion on the floor. So I will call for the vote. All those in favor of order 20-07-21-07 as presented, please say aye.
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 All those opposed, say nay. Motion passes unanimously. Okay, let's move on to item 8A. This is a Health and Human Services discussion item. It is a report back on the 2021 Homeless Winter Strategies and Winter Response Coordination. And we have with us Soraya Johnson, who is our program manager, and Steve Manila, our Human Services Division Manager. Take it away. Soraya, you're on mute.
You're still on mute.
Try it again.
Soraya, I am showing that you are self-muted. Do you see your mute button?
Yeah. Oh, there it goes. I clicked it like 600 times and it didn't work, but now it did. So hooray.
601st is always the magic number.
That's exactly right. That's what my mom taught me as a kid, and it holds true even today. What a wonderful thing. Well, hi again. Now that you can hear me, Chair Book, Commissioners, thank you so much for having us this morning. I'm looking forward to this conversation. This presentation and the documentation that goes along with it is something that is still, I believe, a work in progress. So this is sort of an initial look at what are the possibilities and what are the situations that we're in this coming winter season compared to others, and also sort of shifting some of this talk to inclement weather strategies so that we can encompass a broader range of challenging weather situations, including heat and wildfire smoke and other incidents or weather severity that might come along. So that's a little bit of an expansion over what we typically talk about, but hopefully this will give us a good place to start a conversation. Our weather strategies goal ultimately is to create and support safe places for people to sleep, shelter, and take respite from inclement weather so that we can sustain life and opportunity for all of our community members. At this time, this is particularly important and incumbent on us to find various ways to address weather strategies in light of the COVID-19 pandemic. We'll talk first about the current state of shelter and warming in our community. We'll also talk about the opportunity for long-term impact on our homelessness response system. And then we'll go into, am I freezing up?
I think.
Are you here? Are you hearing me?
Okay.
Okay. Recommended approaches for Lane County. As you know, our primary winter strategies are typically to expand beds at dusk to dawn, sometimes upwards of 260 or a little bit more than that, so that people will have a place to go in the winter, and then to stand up Egan warming centers on nights when the weather will dip below freezing. Those are both strategies that have been tried and true over many years in Lane County and continue to be valuable. However, in a pandemic, expanding beds at dusk to dawn is not a possibility. Right now, they have capacity for 125 people and is likely to remain very close to that, if not at that level. And Egan warming centers are facing a lot of challenges, in particular, looking at sites and finding that most of the sites are not going to be able to support Egan warming centers this coming year. Largely churches, and many of those are churches with congregations of people who are older and at high risk for complications from COVID-19. So that will be very challenging. Also, most of Egan's volunteers find themselves in that age group as well, who may be highly vulnerable to complications from COVID. So those are two challenges. Along with that is really the concept of bringing previously unassociated people together to share congregate space for one night and then release to the streets the next day is clearly risky in a pandemic, to say the least. Right now, we have lost about 250 beds or so to physical distancing because of our COVID-19 CDC recommendations for congregate sheltering. The 75-bed navigation center was originally, at least when I started in February, slated to come online by November of this year, which will not be happening at this time. We have updated numbers from our homelessness by name list, which I'll talk a little bit more about in a minute, but that indicate over 9,600 people in Lane County in 2019 have utilized homelessness services for some duration of time. 80% of our unhoused population is unsheltered, which compares with 35% nationally. So we have a very high level of unsheltered folks. And of our homeless population, about 35% are chronically homeless, which is also comparable to 25% chronically homeless across the country. 70% of our unsheltered and unhoused population typically are in Eugene, about 10% are in Springfield, and then 20% are in rural Lane County, in particular, Cottage Grove, Florence, and Oak Ridge, which have relatively high numbers of per capita unhoused, unsheltered folks. This is our monthly homeless by name list aggregated count. You can see to the top left that within the last 90 days, people who are active on this list for June was around 2,800 people. These numbers go up and down in the winter. Typically, we see over 4,000 people accessing services. In the summer months, that typically goes lower than that for probably obvious reasons, but because it's a bit easier to survive and get what you need during the summer months versus those in the winter. So this is our kind of showcase of where things are right now. Of our 2,800 or so out there using services right now, about half of them are disabled. About a third-ish of them, or I guess in this particular count, more than that, are chronically homeless. Of our veterans, the vast majority of them are chronically homeless as well. Chronically homeless means that they've been homeless for 12 continuous months or for 12 months over a period of 3 years, and a few more details, but those are the kind of the big ones. And they also have a disability. So that's what chronically homeless means. In 2020 year to date, we have 6,023 unduplicated people who have accessed services and utilized our services. We also have this roll up from 2019 that shows our number of active people at 9,679. And then some more kind of aggregate data for the year. And I like the bar chart on the bottom because it does sort of show the ebb and flow of use of the system, with June 2019 being something of an anomaly with a very low number that I'm not totally sure what that is. But it does sort of give us a picture of how services are needed and used and can instruct us as we look for what to do this coming fall and winter. These are our main communities in Lane County that have a high number of unhoused residents. Eugene, these are based on May 2020 numbers, by the way. So Eugene had 2,469 people who were unhoused or unsheltered in May, and that's 14 per 1,000. As you can see, Springfield's number is relatively high, although their per 1,000 is a bit lower. Other communities in Lane County that have a high number per thousand in their population are Cottage Grove and Oak Ridge, both with 18, and Florence with 13. So those are some municipalities that could be brought into this conversation, especially as we look for what's going to happen in this coming season and how might we support our rural communities and Springfield as kind of the metro area, along with the city of Eugene, which is leading the charge on a lot of this work with us, with the county. So we have an opportunity to make an impact in our homelessness system. In the wake of COVID-19, in our first phase of the emergency response, we found partners who were really willing to stand up and take on a lot of things that were not typically in their wheelhouse, or that were in their wheelhouse, but we needed like a lot more wheelhouses to be built all at once. And so we found that we were really stretching the system almost to the breaking point, really, in some cases. And so what we really need to think about is how do we not only make up the ground that we've lost from the shelter capacity that we had once, which was really, to be honest, never enough in the first place, but also recognize the unprecedented nature of this coming season and the impact that it can have on the health of people who are living outside, unsheltered and or unhoused in community shelters, alternative shelters or emergency shelters. We also have an opportunity to leverage funds that are coming to the county and the cities in a different way than they typically do in response to COVID-19 as well. So how can we put these things together so that we can add lasting non-congregate shelter, meaning that people are not sleeping all in one room, but are rather in separate spaces, ideally their very own private space, slightly less ideally as sort of separated as they possibly can be in a common space. And also potentially even adding some housing stock. We could build capacity in the service provider network. In fact, we have to, with all of the recommendations that I'll be sharing with you in a couple of minutes. We absolutely need more provider capacity. The biggest two challenges are finding sites and locations for these things to happen, and making sure that our service providers are adequately funded and staffed and ready to take on a big challenge so that we can move something forward as a community. We also have the opportunity to establish a navigation system, which would allow us to start to implement some of the parts and pieces that make the Navigation Center, low barrier shelter that we plan to open up later. That will start to bring some of those parts and pieces together so that we can help people navigate across the system better and also move into housing more quickly, hopefully. We also have an opportunity to scale test models that were piloted in recent interventions. In particular, the city of Eugene instituted designated temporary shelter sites at several rec centers, and those were run using a community-based model where a camp host was identified in the group, employed to be the camp host, and then received supervision and mentoring. This is both cost effective and also it works great programmatically because you're able to put the onus of power and decision making within the camp itself, giving people who are staying there more say in what happens to them, what their situation is like, and also matching that with accountabilities. I have some very basic budget assumptions here where I'm sharing the cost per bed night. There are more budget pieces and parts and information in the full report, which you can take a look at. And I know Chair Buck had asked for some additional information about that, which I'll turn around and get as quickly as I can. It will take some input from others, so it'll just be a little bit, but I think we can expedite it by this week. The assumptions here is that we need to plan for 12 to 18 months minimum of any and all of these interventions to the degree that we're capable of supporting. The bed night cost estimates include food, management, and supplies, as well as any location costs or rentals and things like that. The cost estimates that are included in the full budget in the report are just for 180 days of operation. So essentially we would want to multiply that by 2 or 3-ish and probably make some other adjustments to that to get a sense of what these interventions will really cost. And we can also mix and match these options based on needs and capacity. So in the full report, there are numbers associated with each of these interventions that suggest how many beds we should be targeting for these. We can add more to some, fewer to others, perhaps use some of these as an interim strategy and then shift to something else as much as possible. Always keeping in mind, again, what is the best impact that we can make for the money that we have available to support these things while keeping people alive through this season and hopefully adding additional capacity to our homelessness systems long term. There are 4 different models that we think are useful for this coming season. Safe sleeping villages, motels, less risky congregate shelter, not a technical term, but one that I'm coining, and permanent housing investment possibilities. Safe sleeping villages, this is a picture of one of Eugene's designated temporary shelter sites that ran during the first phase of COVID-19's emergency response. These are great because they can be flexible for various populations. They can work for single adults or partnered adults, people with pets. They can work for families potentially, depending on the kinds of structures that we put in place. They could work for people who are medically vulnerable, but still have the ability to sleep outside. There are lots of different possibilities for this. Some of the benefits are that it can be scaled and improved. So we could start with platform tents and then move to Conestoga huts over time, or tiny homes or other different kinds of facilities. There are supported employment opportunities as well embedded in the model that I'm projecting or suggesting that we utilize. There are staffing considerations also included in your full report. The policy we would need to change in really any municipality that would be willing to stand these up is to see if we could expand current ordinances to at least temporarily allow up to 40 people per site in pods of 10 people with up to 6 structures within each pod. So some of those tents would probably be doubled up with partners or small families. That would allow us to house as many people as possible. As I mentioned earlier, siting is one of our biggest challenges and continues to be. And so if we can maximize the use of those sites while also keeping the pods small and manageable, that would be an ideal situation. The cost per bed night ranges from $20 to $36, depending on staffing, depending on what we put into the camp to set it up, and a few other factors. But that's a range that is probable for this intervention. Motels are a good and more immediately available option for people who are medically vulnerable and also need to sleep inside. Many of them right now are not able to sleep inside, and this was something that emerged for us during the COVID-19 pandemic response, that we had a lot of people discharged from hospital facilities to in particular the Springfield Memorial Building respite shelter, and found that a lot of these folks really needed ongoing care and caretaking. Those kinds of people who have a lot of underlying conditions and who may be older could be placed into these motels, depending on how many we have available. There are some hoteliers who have expressed interest in helping with this situation recently, including long-term leases on a hotel or motel that could suit this need. And or we could work this as a more immediate intervention. And then if we're able to add additional permanent units, we could shift people into those over time, just again, as a way to maximize our investment and the return on those investments. The estimated cost per bed night on this is up to about $85. It could go a little bit higher depending on the cost per night at the motel, but this also includes a staffing model included in your full report. And then we have lower risk congregate shelter. What we would be looking at with this is to find a way to make sure that people are not put into spaces with too many other individuals, and ideally that they would be in a consistent group. So these shelters wouldn't necessarily be set up as a first come, first serve model where people are waiting outside to get a bed and then they sleep there for a night and then they leave. I think that we would probably want to see if we can engage more long-term stayers, limit the number of guests to 40 or less, and make sure that there is ample space for each individual that is going to be staying in the shelter to have at least 144 square feet of bed space so that there's enough space between beds according to CEC sheltering guidelines for congregate shelters. This could be a good strategy in municipalities where there's strict camping ordinances and codes that would not allow for a safe sleeping village of more than 3 tents or other structures. So this may be something that we need to pursue in some cities if they're not interested or willing to adjust the code that they have. The estimated cost per bed night really ranges widely. It really depends on how many people are there, what kind of population is there, and things like that. So anywhere between 49 up to kind of in the 80s. And then finally, we have our permanent housing and lasting structures. So there are, in your full packet, the main modules that I provided with you with additional information about are stackable modules that could be deployed immediately and then later repurposed and built into up to 3-story structures. The top picture here is a floor plan example of one of those modular units. It includes 2 rooms, 2 beds, and 2 private bathrooms. And that could be, placed in a complex or on a site with multiple other units like that. Or there are also models that have 5 beds and share 2 bathrooms or 3 bathrooms. And just sort of depending on what we want to do, we can make some decisions about that if that seems like a good possibility. To the left, the picture from above of the 4 beds on kind of a tan ground is a different type of modular structure that is more like a kind of a camp or a military camp based type structure, though it is durable and can last for a long time. This could also be a way that we could create shelter at safe sleeping villages and use this model to create, up to 4 rooms within one of these modulars, which are pretty affordable. Then we also have other kinds of durable units that we could be investing in to add to our housing stock. And I say housing stock very specifically because if we're able to create units, even if they're small, that fit HUD habitation standards, then we can count them as shelter, as emergency shelter rather than alternative shelter, which is important to our continuum of care outcomes, showing that more people are in shelter than not. And ultimately, it gives us, I think, more flexibility in what we do with these sites over time. So we might start with safe sleeping villages. They might morph into some other kind of approach that might become more permanent, depending on the location, depending on the neighborhoods and all of that. So these are a lot of different options. Other things we obviously have to consider is funding. So there is a helpful document about prioritizing federal funds for non-congregate sheltering. Their suggestion on how to prioritize is first start with FEMA Category B to whatever degree you can, then bringing in ESG emergency services grants, the coronavirus funds for that, and then CDBG coronavirus. And we also have coronavirus relief funds potentially coming from the state that might be able to be allocated to some degree for these things. And Steve Manella will speak to the funding piece in just one second. The other piece that I mentioned, siting is extremely challenging, so we will need to engage neighborhoods, policymakers, local governments, private owners, nonprofits to find all the possible places that people can sleep at night and that we can work within our neighborhood associations in Eugene and in other groups and kind of compassionate groups in the neighborhoods elsewhere to find locations for people and, vet them and approve them and get going on setting them up. And then ultimately, we do really need to build service capacity in our nonprofits who are serving this need. We need to support them through training, through funding, through all kinds of other interventions that we can use, and then work to stand up teams right now so that we're ready to launch in before cold weather hits on these shelter strategies and the services that go with them. And I'll turn it over to you, Steve, but I'll keep the screen for my screen and let you talk for a moment about funding, Steve.
Okay, thank you. And I'm hoping that you can see the information that's before you. Chair Buck, Board of County Commissioners, I just want to thank Sarai Johnson. I think this is probably the most comprehensive report that we've been given and the earliest date that we've had a report for our winter strategies. And so the investment by the county and the city to have her doing this work is outstanding. What I'm going to go through very briefly is, as Sarai had mentioned, through the coronavirus funding through the CARES Act, We have received allocations of funding that we are able to put towards the work that Sarai had presented to you. The money that we're receiving is the Emergency Solution Grant. The first round of funding is a little under $1 million. What you see before you is a piece that Amanda Borta, who's the program service coordinator on our staff, put together and presented to the executive committee this past week of the Poverty and Homelessness Board. They are the Continuum of Care Board for the HUD funding that we received through our department. So as you can see, the priority for the first $1 million that we have now under contract with the state of Oregon is for outreach into the rural areas, assisting folks that are camping in rural Lane County or are on the streets in our smaller cities in rural Lane County and providing humanitarian assistance to them. And then emergency shelter for those that are at highest risk for COVID-19. So this makes available immediately for the emergency shelter portion of the discussion a little under $800,000. And the types of things that we could do are listed below. The second allocation of funding, and the state of Oregon has not applied to HUD yet for the second round of funding, so they need a little nudge with that, is likely to be another $5 to $7 million based upon the funding formula that the state has. The state of Oregon received $49 million from HUD. The second round was greater because HUD used a funding formula that was based on the number of homeless in the state, and particularly they weighted the number of unsheltered homeless. So this more adequately addresses our need. These dollars are available over the next two federal fiscal years. So we can program these dollars both for this winter and for next winter, as well as the COVID emergency duration. With these funds, again, a continuation of street outreach. Additionally, we would like to provide more healthcare, mobile healthcare, mobile mental health care kinds of options for people who are living unsheltered. And we would like to provide more healthcare and mental health services to people who are sheltered in places like the Eugene Mission and Dawn to Dawn. Additionally, again, the continuation of and expansion of additional emergency shelter options. You see rapid rehousing here, which rapid rehousing is providing for first, last, and deposit, and providing for rental assistance for people who are homeless, bringing them back into their a home. And then targeted assistance for youth, families, rural households, and Latinx households. So this is just, both of these documents are conceptual plans. We have flexibility. We can provide with this funding, street outreach, shelter case management, shelter operations, rapid rehousing case management, rapid rehousing rental assistance, other types of financial assistance, case management services for homeless prevention, and homeless prevention rental assistance. One of the reasons that you don't see from my staff initially a recommendation for using this funding for homeless prevention and rental assistance is that thus far we have been receiving large sums of money for rental assistance from other coronavirus federal funding sources. If that is not to continue, then I think what you would see as a part of the second phase of this ESG funding that we will receive is a consideration for a larger portion going towards homeless prevention as a part of this. So this is just food for thought. The process will be that we'll be discussing this next this week at the Poverty and Homelessness Board Shelter Stakeholder Committee. And then we will be also meeting in August with the Human Services Commission and with the Poverty and Homelessness Board, and bringing back to the Board of Commissioners as soon as we can, first for round one and then round two, a plan with strategies. I want to reinforce what Sarai had said earlier. Siting for shelter is going to be the most difficult part of this task. We have little time to find sites. The other piece that I would mention is that the legislature passed supersiding legislation that requires that within 90 days that we put our list of sites into whichever jurisdiction we intend to do shelters. We have 90 days to identify sites within the municipalities of Lane County that we would like to use for this purpose. Thank you.
Thank you. Commissioner Farr.
Thank you, Chair Buck. I'm going to be ever so brief because it's more important that I write down the things that that other commissioners are asking and the responses from Sarai and from Steve Manella. Chair Buck, I want to point out that you've spent a lot of years doing much of the work that we're talking about today. You have rehabilitated mobile home parks, for instance. You've found ways to put people living in poverty into better housing situations. Today, the most important element is something that you personally are very aware of, and we all are increasingly more and more aware of, and that is siting. Mr. Manella mentioned that the Shelter Stakeholder Committee meets on Thursday. One of the main things we will talk about is siting, and it's an opportunity for a multi-jurisdictional approach to finding siting. Lane County can't do it alone. The city of Eugene and Springfield can't do it alone. The outlying cities cannot do it alone. We need all boots on the ground, everybody working on finding ways to place housing units into acceptable places in our community. We've run across obstacles along the way. Very recently, my neighbors refused to allow 11 homeless boys who were going to school to live in their neighborhood. So if you take even what should be the easiest people to be accepted in the neighborhoods, we have difficulty there. That makes it a very daunting task for us all to find places to put the shelter. During COVID in particular, we're finding pots of money here and there, sources of revenue here and there that can help us with this. But in the meantime, if we don't have a place to put them, it's not going to happen. I'm going to listen to what you all have to say because I know everybody in this room has a heart for this and has a heart to make it happen. And every time that we have an opportunity to get multi-jurisdictional discussion on it, then we need to leap at that opportunity. And every time we have an opportunity to make sure that people are reading from the same page and reciting the same language, then we need to jump at that opportunity. With that, Chair Buck, I'm going to just sit down and write as my fellow commissioners talk about this impending emergency. With one last comment, back in 1995, we didn't have winter strategies. In 2011, when I got back to the Board of County Commissioners, we started talking about winter strategies in November. What is happening today is an increased year-round discussion regarding winter strategies. We're getting better at it. We're getting more proficient at it. The more we talk about it, the more we read from the same page, ultimately we're going to be able to say we've done a good job.
Any other questions or comments? I'll just start off. Oh, Commissioner Bosevich, let you go first.
Oh, thank you. Great report. A couple of quick questions just so I can understand what I'm looking at. Started out with some stats, and it mentioned disabled and veterans. How is disabled defined, and who is actually doing that? Is that self-reported? Same thing with veteran status. Is it a self-reported veteran status, or is it confirmed?
Ooh, good question. I probably defer that to Steve. You might have a better sense.
Yeah, that's self-reported.
Thank you. I just wanted to define that because that has been controversial in the past. Along with that, then, sorry, I lost there. There we go. I also was kind of curious why Veneta was not listed in those cities, because I know for a fact that there's more than 13 homeless in the Veneta area, and our population's actually right on a par with Junction City, and they were listed. So, just being familiar with my district somewhat, I was really surprised they weren't one of those listed communities and and particularly having a high rate per thousand. So just one more question about some of the initial stats. You mentioned there were like 350 units short. We approved over 90 units to be created with our housing improvement project, I think 2.1 million that the board allocated a few years ago. And I know quite a few of those are coming online, such as MLK Commons 51 units that will be online in November. And I assume some of the other units, like the ones in Cottage Grove, are also coming online. So is that 350 not counting those units that will be coming online?
Chair Book, Commissioner Bozovich, yes, it is. There are actually two different types of units. So when I'm talking about beds, I'm talking about emergency shelter. And when we're talking about units, we're typically talking about permanent supportive housing. So that's which is what MLK Commons is.
Yeah, the 90 some is permanent supportive housing. I just want to make that clear. So my big question is you had that list of who we're supposed to ask first for money. What you didn't describe was what is their priority for funding. Do they want to fund tiny homes before they fund, say, sleeping villages? Do they like hotels better than low risk congregate settings? What is their, what are they more willing to fund? Knowing that some things are much more costly on the front end with capital, like tiny homes, but might be less costly on a per night basis, long run. So I'm just kind of curious, did they, in that list of people that will provide funding, do they have a set of priorities that we ought to be concentrating on those programs that match their priorities?
Yeah, that's a good question. I think that the trends that we're seeing with FEMA Category B in particular, that they're moving more toward suggesting non-congregate options, and they have definitely funded a great degree of hotel motel uses in other places, including Portland, Seattle, San Francisco, and actually all across California. They have a big project Room Key there that's largely funded by FEMA. There's not an indication about whether they would help fund a modular purchase, for instance. So I'm not exactly sure on what that would be. We would have to submit a request to them for pre-approval and see what they say about that. But they did approve our non-congregate request for the purchase of River Avenue when we were working on that. So it's not out of the question that they would allow us to purchase facilities or units that could last long term. It's certainly really how we want to strategize as a county and communities to see what works best for us here, and then presenting to them, here's our plan, and this is why our plan makes the most sense versus every other plan. So yeah, I think, I don't know if that's totally answering your question. It's a little bit of it depends, but it is also, true that they did fund congregate shelter when we had our emergency respite shelters going. They did fund I believe, as far as I know, they funded the designated temporary shelter sites that the city of Eugene set up, which is like the safe sleeping villages. They've definitely funded motels. And they've funded a permanent structure for us, or would have. I don't think we ended up going with FEMA, but that was on the table for sure. So I think we have a lot of options with that.
All right, I guess my comment to some of that is I like the idea of getting some more permanent, style housing like the tiny homes. My concern is, as we're talking winter strategies, it's July 21st. November's coming fast. I don't know if we're going to get tiny homes sited, constructed, and ready by November. So it may be that we want to concentrate on ask them about that maybe for continuing some of our strategies on homelessness. But I think right now, I think we need to concentrate on what we can get up and running for this winter that will, be safe under the COVID-19 conditions. And I think we need to seriously, look at what they're used to funding, which sounds like hotels and some of the other stuff, and move as strong ahead with that. Unfortunately, though, we haven't had a whole lot of cooperation with hotels since COVID started. And so that's going to be a completely different discussion, and trying to get those folks to be cooperative and make space available. But knowing that the room occupancy count dropped pretty heavily for the hotel industry, maybe we'll have, now that it's been a few months, they might be more cooperative just on a financial basis. But I appreciate that. Final thought, though, was, as you mentioned, veterans and all that, I have not heard much about Veterans Legacy. And their original model, if they got it set up, was to have individual dorm bunk rooms kind of for each veteran, where they are separated individually out there. So I don't know if we need to touch base with those folks about their ability to take in some of our veteran homeless population and keep them in individual rooms. And there's a lot of outdoor setting there, so it's maybe a much more safe environment in some ways to put people in, even though it is pretty far away from some other services. But just don't want to forget about those guys.
Any other comments? I've got plenty. So, Commissioner Bernie.
You want to go?
Go ahead. Go ahead. I'll wait. I'll defer until everybody's done.
Thank you, Stephen Sarai. I don't know where to start. What is your, obviously, we're getting an influx of dollars through this COVID stuff. What is your sense?
Commissioner, I don't mean to interrupt, but your sound is really low and it sounds like little mice are behind you. I'm not sure if that's a microphone.
They're my pets. I'm just talking.
Okay.
Does it not work?
No, go ahead. I'll turn my volume up.
Usually my mice are quieter. I apologize. Sarai, what is your best sense of the best possible scenario once we hit winter this year as a result of this strategizing?
Oh, the best possible scenario? Can it be a dream scenario?
No. The best possible realistic that you see as doable scenario once winter hits this year as a result of this process.
Chair, Commissioner Bernie, my opinion on that is that I think that we have a lot of opportunity to get as many people into safe shelter and places that they are able and allowed to sleep at night as possible. One of the things, I think this is maybe something you were saying a second ago, but I couldn't hear exactly, is that we've had a lot more visible camping than we typically have had over the last few months, because CDC guidelines have indicated that the best thing to do with encampments is to let them be there, help them with social distancing, provide them with portable toilets, hand washing stations, garbage service. That has obviously resulted in a lot more of that kind of camping, which is not necessarily incompatible with public health needs, but it can become that way if we're not able to truly do the work with these folks. And it's also challenging because if we're not saying where people can go, but then asking them to move from a place that they have chosen for themselves or where they've kind of gathered with others, it's really difficult to keep them, in service or keep them connected to their service providers and all of that stuff. So I'd say that my personal best outcome would be that we create as many shelter beds and places where people can stay for the duration of the pandemic as we possibly can, which I would indicate would be 1,000 or more beds. Likely, that's a very ambitious number, obviously, much more than we've ever done in the past. But to me, a critical mass of making sure that we're triaging the people who are most medically vulnerable, who have the highest level of need, and who need and want this kind of a thing, which most people that I talk to who are currently living outside or unsheltered or unhoused really indicate that having a place to sleep at night is the most important thing to them.
No, I totally agree. I applaud your efforts. My questions are really to clarification, not criticism. I believe we can chew gum and walk at the same time. So I'm assuming that part of this is maximizing relief for the immediate need, and also, as people have discussed, looking at developing more units around.
Commissioner, it's really challenging to hear you. I'm not sure what's happening. Sorry. Yeah, it must be the connection.
Can no one hear me?
I can barely hear you.
Okay, well.
All right. Any other questions or comments? I just want to add that I'm really pleased with the report so far. I know that it is a work in progress and will be one of our quote unquote living documents, and will change over time as more opportunities present themselves. I very much believe that we need to go full steam on all and any options that you find, knowing that some of them are long-term, some of them are short-term, some of them won't work out. And then again, other opportunities will present themselves that we've never thought of. And we can't wait. This is a massive issue that requires our dedication and time and energy every single day, because it's going to be winter real soon. May feel really sunny and warm out right now. It's going to be cold soon. We all realize that we cannot necessarily rely on volunteers like we did before. And even before, it was unsustainable. We need to know that we can manage and operate any shelter of any capacity at any time as needed. And we need to make sure that we have the funding behind that to make it happen, which begs the question, do we have a committee that's working specifically on trying to find funding resources for shelter and shelter needs? That is really what they're dedicated to looking at. Maybe that may be in another subcommittee somewhere that I'm just not aware of. And if it's not, I would highly recommend that we have something like that. And the portion of the financials that I was looking at and gave feedback was, some of these have setup costs, which we may be able to find now during some CARES relief funding that comes through, but that is one-time initial startup costs. So there's no reason to spend that money if we cannot operationally pay for that on an ongoing manner. We have to make sure we have the full package working. And that, of course, then again, takes additional time and effort before something's launched. So there's an additional delay. But I don't want to start something we can't keep going. But I also don't want to hesitate on opportunities that come our way. We know that we landed on that opportunity with River Avenue, and we don't know how long we'll actually be able to put that and implement it into a transition for a homeless shelter. But I want to look at every opportunity that we can continue to do that now while these funding opportunities present themselves, so that we have a long-term investment. I hate to see every year, and as you mentioned in your report very clearly, which I appreciate, that we don't want to invest millions of dollars every winter for it not to go towards a long-term solution. Of course, we want to care for people and want to keep them alive and fed and warm. But we don't want to circle an additional several $1 million every year without any long-term solution. So I really appreciate your thought and care when you're looking at operating like this. The last comment I wanted to add was that we have nearly or just shy of almost 10,000 people unhoused in Lane County. That is a lot of people, a lot of people. We know we're not going to be able to care for all of them, but those are big numbers, and we need plan A, plan B, plan C, plan D, and that can be, large areas of land where we can set up smaller tents and care for them, and lots of them all over. And we just can't have 10,000 people unsheltered in our community. I just find that fully unacceptable. We need to make sure that we have those big plans ready to go in place on time and funded before winter occurs. That's our challenge. Commissioner Burney.
Can you hear me?
Barely.
Okay.
Yeah.
I'm going to yell. Can you hear me better when I yell?
Yes.
Thank you. Forgive me. It's going to sound, Sarai, how many hotels do you have relationships with now that are prepared to assist in the effort you discussed?
Commissioner Burney, there are 2 hotels or motels that have approached public health with offers to lease them long-term, at least 6 to 8 months, at a pretty reasonable rate. So we probably could get about 126-ish rooms from those 2 motels, if those were the ones we wanted to pursue.
Perfect. Thank you so much. And in terms of, I'm really yelling. I won't even last till noon at this rate. In terms of long-term capacity, are you aware, I'm probably only aware of a couple, of 2 private efforts that are being planned, may or may not be implemented right now. One to build 100 to 150 tiny homes, and one to looking at 400 units. One, are you aware of these? And 2, if whether you are or not, does Lane County have the ability within this CARES funding to provide a small amount of dollars structured as a subsidy in some way to create permanent long-term housing?
Commissioner Burney, I don't know about the 400 units specifically, but I do believe I am aware of the tiny homes plans. The timeline on those are not immediate, and I'm not sure what would need to happen to to kind of fast forward them. But I'm sure that we could talk about that and try to work out a way to do some things like that.
Okay. Hey, thanks so much. I'm so frustrated with this connection. Thank you very much.
Any other comments from commissioners or questions? All right, I'm not seeing any. I want to thank you, Sarai, for this report and look forward to ongoing reports. I know this is an item on our board assignments. Very good. We have one final item in other business, and I have one that I thought I'd just share if people could think about during the break. So this is regarding Ferry Street Village. And I'm not sure how many people are aware of this, but Lane County had a role in the destruction of Ferry Street Village. This is brought up in the Lane County Historical Society. And the Ferry Street Village was a Black community that was living at the site where Ferry Street Bridge was built. And when the county and its citizens decided it wanted to build a bridge, Lane County's roads department at the time, precursor to Public Works, went and destroyed that particular village and proceeded to build Ferry Street Bridge. And we have also our Public Works Director, Dan Hurley, put in an article in his newsletter about this historical event, and has been working with Eric Richardson from the NAACP regarding a project and trying to tie that historical event into a larger walking, driving tour of Black history for our area. They met with the City of Eugene Park staff, and everybody was supportive of dedicating a portion of Alton Baker Park to this project. I bring it up because I think it's important for us as the county to acknowledge this occurred in our past through a board resolution, and to support the work that they're doing to put some kind of dedication together at Alton Baker Park. So it's something to think about for us on the board. I would very much like to get head nods for our board to support this important project and make sure that we acknowledge our history. So I'm particularly asking for head nods. Commissioner Bozovich?
Thank you. I just want to hopefully make you aware that that particular area used to flood on a regular basis prior to the installation of the dams. I've seen photos of the Ferry Street Bridge where only the superstructure was showing during some of the flood events that we used to have prior to the core dams. And understanding some of that history and the fact that that village was located in a floodplain, it may not, that might not be the whole story and I just would hope we could do some significant research before we jump to a resolution. That's all. I'd like to understand the full history.
I think Greg has some more background, but I did see Commissioner Farr's hand up first.
Thank you. The historical note that Commissioner Bozovich made about the flooding is accurate, but that also demonstrates the relegation that was assigned to the members of the Black community who lived here. They were given the place that they had to move every winter anyway. You know, it was a horrible place. It was an inhospitable. We talk about HUD's habitability standards. I mean, they were on the floodplain. It was horrible to begin with, and it really is a part of Chair Buck, I believe, the discussion that we would have in preparation for and discussion of the resolution. So I am in favor of the in favor of the work that you're proposing. Thank you.
Commissioner Sorensen, then I'll have Mr. Rickoff speak.
Thank you very much for bringing this up. And I agree we need to get more information. Maybe Mr. Rickoff's going to provide that. But regarding Lane County's role in destroying the area or taking people's belongings away from them and clearing the area out rather forcibly. You know, this is a time in our history, American history, going on right now where we need to come to terms with what people have done and and try to move toward a better way of recognizing what has happened so that we can avoid it in the future. And I just think what you've reported that, Mr. Hurley is doing and working with Eugene and working with the leaders of the Black community, it's really important that we, own this history and try to repent from it. And so I'm all in favor of it. I'd like a lot more information, but my understanding is that the committee was moved basically each winter and came back over the summer. But I'd like to know more about it. I certainly like to be part of a public recognition and apology. Thank you.
Mr. Rickoff?
Chair Buck, Commissioners, Commissioner Farr spoke to this quite well. Lane County has a role in both creating as well as dismantling Ferry Street Bridge area. My understanding is that the head nods have been received, and you should see this on the assignment list at the end of the meeting. Is that accurate? So at this point, it'll be a more thorough exploration of the history of the Ferry Street Bridge area.
Commissioner Bernie?
Can you hear me?
Yes, much better.
Oh my God. I want to thank those board members that have been trying to provide me technical assistance. If possible, maybe this could also, as you look at this, Greg, we could have information about when Blacks were allowed to own property in Oregon. Was there a connection between the floodplain location of the 10 to 12 homes called Ferry Street Village and Vanport in Portland? What were the relocation, if any, something a little more comprehensive and contextual, I think would be really useful. Thank you very much, and I'm delighted you can hear. Thank you.
Okay, anything for the rest of the morning meeting? Okay, I don't see anything further. So we are in recess until 1:30. We'll see you all then.